session, or you're just going up there?
Joseph Stern.
Definitely. Good morning and good. Thank you. Good morning. We are going to get ready to open up with our um, budget workshop this morning. Thank all of you for being here this morning. We're going to open up now with a word of prayer, and following prayer, we'll do the invocation. Pray with me, please. Father, we thank you for this day. We thank you for another opportunity, Lord, to worship you and give you praise and honor. Thank you, Lord, for allowing us to come together to discuss county business. Um, Father, we pray for your understanding. We pray for your wisdom and your knowledge. Bless everyone that come before us today, Lord. Bless this community, Lord, and we pray that you would bless the Nolan family, God. In this time, we pray right now. All these prayers in your Son Jesus' name, we pray. Amen. Amen. Good morning. How you doing, Doc? You doing all right? I pledge allegiance to the flag of the United States and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm going to turn it over to Miss Brittany now.
Good morning.
Good morning.
I'll point out this will be in the appropriation workbook today, so this will be the separate workbook that we've been working from for the past 2 days. On page 2, or 1 of the notebook, there is a summary page of all the requests from the entities. Our first entity will be Newton County Health Department, and their request this year is $187,550.
Good morning.
Good morning, sir. My name is Joseph Sternberg. I'm the Chief Operations Officer for the Health Department. I also have Ms. Betty Vitale, who is our Budget Director. Dr. Rona does send her apologies for not being able to be here. She wishes she could, but she had a conflicting meeting this morning.
Okay.
As she mentioned, we are requesting $187,550, which is level funding over the past several years. What we do with that funding, if you look at the sheet that I kind of handed out to y'all, which shows what our services are, we provide public health services. That includes immunizations, our WIC services. A lot of feedback. We'll stand over here. So immunizations, WIC services, our child health child health services, reproductive health services, and general labs, a lot of services we provide in the community. From a funding standpoint, while the Newton County subsidy only accounts for about 9% of our total budget, it accounts for at least one environmental health person and one clinical person. So if you look at the individual services on the front, it accounts for about 20%. That one staff that Newton County provides 20% of those environmental clinical services, and then on the back side, the environmental health, about 25% of those environmental health services. So again, even though it's only about 10% of the budget, has a significant impact on the services we can provide in the community. Some of the things that we have been working on over the last year or so, the biggest one is probably a transition from the WIC vouchers, the paper vouchers that we used to have for 50 years, to an e-WIC system. If you've seen the cards that are used for like food stamps and similar programs, WIC has now transitioned to that card also. It kind of helps remove the stigma associated with those paper vouchers, and we are actually seeing an increase in WIC participation because people are a little bit more comfortable using that payment method. We can get you numbers if you want to know about that actual increase, but it's been a noticeable increase in participation, which is good for the community. It also brings dollars into the community because those WIC vouchers are spent, or WIC dollars are spent into local businesses. The other thing that we've been doing, I kind of handed y'all an example, are these, we'll call them opioid response kits. As you've seen in the news and heard in the community, opioid overdoses are increasing. We saw a huge spike after COVID-19, and we're seeing a continued increase due to primarily laced drugs. It's not, we'll call them normal illicit drugs. It's fentanyl and other things that are in the drugs that people are not knowingly taking. So in this box is information about how to respond to overdoses, as well as naloxone, Narcan. So there's 2 doses in here that will help reverse opioid-related overdoses. We started giving these out in the health centers for free probably about a week and a half ago, and we've given over 100 so far. With the change that has recently happened, I don't know if y'all heard yesterday, FDA is now starting to allow over-the-counter distribution or purchasing of Narcan. We will, working with the county, working with some of our community partners, start trying to flood the community with Narcan to try to get rid of the overdoses. If we can do that, I mean, it saves lives. There's no risk to accidentally giving somebody this. If somebody's not having an overdose and you give them Narcan, no risk. But if you do give them that and they are having an overdose, it reverses it quickly. It can save lives. The other thing that we're kind of working on, as I assume everyone is hiring. Nurses are near impossible to hire due to the shortages that happen in the hospital. We're competing with hospitals, private providers, everybody else. So we're seeing a big difficulty in hiring nurses. The one last thing that I want to point out, if you look at the back side of the page I gave you, the environmental health part, we are seeing a pretty significant increase in the number of new developments as far as septic systems. Typically, we use that as an indicator of economic growth in the community, and as a comparison, Newton had about 400 new septic permits. Gwinnett had 200. So Newton in that area is growing significantly faster, and we're seeing a lot of those houses or those subdivisions that were developed back in 2008 starting to be built out, which again is good for the community because it's bringing in more citizens, bringing in more dollars. Again, to summarize it all up, we are requesting level funding. Of course, if the county has additional funds, we'd be more than happy to take any of those additional funds because we do use them for initiatives like these Narcan kits. They're not cheap. We purchase them as we can. And again, we appreciate the support that the commissioners have given for the last 50 years. Any questions?
No, sir, I don't have any questions, but I do want to just commend you guys on the great job that you guys are doing for our communities. Not only our community, but I want to recognize what you're doing in our community. So thank you so much.
Appreciate it. Thank
Yes,
you.
sir.
Up next on our schedule will be Viewpoint Health, and their information can be found starting on page 58 of your book.
Yes, sir. To go out. I do have family,
Yeah, could I have a gentleman come back up one more time, because I had a question I was asking about, what is it, Narcan, or what do you
Yep,
call it?
yep.
the drug? And I'm sorry, please
Joseph.
forgive me.
Joseph.
Okay,
Yes,
this is
sir.
Mr. Joseph. The question I had to ask you was that, like you said, it was on TV and they're talking about it, but I thought they had said they were gonna charge, they were gonna send it to, I guess, local pharmacies or stores, whatever, and there would be a charge for that. And I was trying to think, that you wanna make it available to people free, so if somebody who had overdosed, and we know we got a lot of people who do stuff they shouldn't be doing,
That's correct.
and make it free so they have, maybe at a drugstore. 'Cause I remember one man came on and said that somebody was having or had overdosed outside his pharmacy. He came in the pharmacy, got one, gave it to him, and he saved their life. And so, are we trying to get up to our officers? Do our officers have this package in their vehicles?
There are currently some restrictions on how we, public health can give it out. We're doing everything that we can to get it into the community. We've partnered with some federal agencies, HIDA, which is, I don't know the acronym for it, but it's a federal agency that helps with, overdoses and drug trafficking. So they're involved with it. But as this requirement that it be a prescription loosens and becomes over-the-counter like Tylenol and all that kind of stuff,
Right.
the ability that we have to push it out in the community, to give it to first responders, police, fire, that's our ultimate plan anyway, is to have those kits available that when emergency responders go out to a house and somebody is having an overdose, even if you transport them out, leave a kit behind, because eventually they're gonna come back. So that is the plan, and as we'll call it the over-the-counter version of naloxone becomes available, we'll start using our same mechanisms and actually pushing that out deeper and deeper in the community. It's gonna take a couple of months,
Right.
because they have to redo all the packaging at the manufacturer level. But once that stuff comes out, we'll use the funding that we have available to get it out to those areas that are experiencing, higher rates of overdoses. And we were definitely gonna ask for y'all's input, to help us identify those areas. What we don't wanna do is only focus on the places that are having, confirmed overdoses, but those that are at risk for overdose. Because if you can get them before they go to the hospital, it's a little bit better than
Right.
getting them
I
after they've
agree.
already overdosed. So,
I agree.
Okay.
Thank you for your service.
That's a good question, Commissioner. Let me ask a follow-up question. How are we, so what are your plans to get it out in the community, I guess?
So as it becomes available over the counter, so the ultimate plan that we have right now is working with police, fire, EMS first, because they're the ones that get the calls about overdoses. And then it's working with our mental health partners to, again, push it out in the community. We'll use funding that we can get from different sources. Some of the funding that we get for our opioid responses now actually prevent us from buying Narcan. We can give it out, we just can't buy it. So there's a little kind of a catch-22 there. So we use any additional funding, either that the county makes available to us, or if we have a position become vacant, and that in-between time before when it becomes vacant to when we fill that position, that salary savings, we throw that into these initiatives. So any dollar that we can get our hands on, we're pushing out, into this initiative, because we realize how important it is.
Okay.
Yeah, that as of right now is our number one priority in our communities, is opioid reduction.
Okay.
Thank you very much.
Thank you, sir. Ms. Jennifer, you ready for viewpoint? Yeah. Good morning.
Good morning. How's everyone today?
Great. How you doing, sir?
Good. Hi, I'm Eric Norton. I'm the CFO for Viewpoint Health. Before I start talking about the FY24 subsidy, I just want to once again thank you for the contributions you made last year, $400,000 to open up the detox unit. We were able to open 2 weeks ago on March 15th. We've had 8 clients so far. 5 of them have successfully completed detox and been discharged, leaving 3 people there currently, and I think we'd have another admission sometime this morning. So I just want to give you that brief update and once again to say thank you.
Thank you. That was, I think that was pushed by Commissioner Henderson. That was led by him. Yep.
Yes.
So thank you.
All right. So for FY24, we're asking for $372,068. That reflects an increase of $117,786. We're asking to start a co-responder program in Newton County, working with the sheriff. We have had quite a few conversations with the sheriff, with Sheriff Brown. He is very supportive. As you're probably aware, we have co-responders in Gwinnett County. We started out with just as a pilot program, it was kind of an as-need basis. They recognized the need for it. It grew to 1 clinician, and then last June, they increased it to 6 clinicians, having 1 for each precinct, and there's talks of actually doubling that next year. We also are in the city of Lawrenceville, working with their police department, city of Suwanee, and a few other communities, and we think it's been very successful. We've been able to divert, I believe, about 98.5% of the people from the jail system. So not only does it work for the people, the citizens, but it also provides quite a savings in public safety. So with this funding, we would be able to hire 1 clinician. We would have continual support from the entire team. So we've included a little supervision support there to pay for equipment. It could be a laptop, a bulletproof vest, things of that nature. And I think what we found working with the other departments is that they like working with us and having our clinicians because we can provide a continual care. So it's not just from that 1 incident, but it's just working with that individual throughout to get them better.
Thank you.
Any questions?
Thank you, sir. Commissioner Henderson.
So, I guess the bulletproof vests are for the people who go out checking on the people who's out in the.
Well,
I'm
since
asking-
they're going out with the police officers just for their own
Okay.
safety, I mean, then obviously they're not going to engage and they will stay away if it's really a bad
hope not.
situation, but it's just, it's just a precaution.
Just one last question. We know that we have, I think, 8 rooms to help people, who drug addiction, may need some help. So, but when I had the opportunity and came over that particular day, y'all kind of tricked me over because I wasn't planning on going nowhere. I was going to stay at home. And we came over and I seen Sheriff Levitt and Sheriff Brown. And it immediately hit me that we need more help for people in our community, not only here in Newton, but Rockdale and I think is it Walden County too?
Gwinnett.
No.
Gwinnett, I'm sorry, correct, Gwinnett. And so I think, are we the only one that has about 8 beds?
So our long-term plan is once we are able to hopefully succeed with DBHDD, is to be able to convert some of our beds in Gwinnett so we can have more detox beds, but that's going to require the building out of a whole BHCC. But until then, this is it.
Okay.
But the good thing is for us, it relieves the pressure that we see at our CSU right now by having these 8 beds here.
Okay, well, I mean, and that's good. I was just thinking that the way that I see from news reports and out in the community that it's really it's not gonna get any better. It's probably gonna get worse. And the gentleman who came before you, he was giving us this, and we need it all over the community because
Right.
that drug is really something doing a whole lot to a whole lot of people. Because I firsthand seen a couple of gentlemen down the street from me where I live, he was just stressed out, and I guess he had overdosed. And if we would have had, and maybe could have helped him. Now he didn't die or anything, so I'm not talking about
Right.
somebody who died from an overdose or something. But there would have been another something available to help him, possibly. And so I
Yeah, we
think
definitely agree.
we got the epidemic out in our community.
Yeah.
And we thank you for your service. I do.
Well, thank you.
sir.
And thank you for your continued partnership.
And just so Sheriff Brown did come before us yesterday, and he did talk about the importance of having a clinician with on their team like Gwinnett and Rockdale. So I'm hoping that the board will consider that.
All right, thank you.
All right, thank you. Thank you, Jennifer. Good morning. Yep.
Up next on the schedule is the Highway 278 CID, and their request is in the amount of $30,000, and they can be found on page 86 of the book.
Good morning.
Thank you for allowing me to come before you this morning. The Highway 278 requests $30,000, and that $30,000 is to pay 1/3 of our project manager. As you know, we have increased the property values on 278 almost 40% since 2017. And that's the largest increase in property tax valuations, I think, in the county anywhere. I'll have to double check that, but that's the indication I've been given. We have applied for grants to get, I'm sorry, I either can read or see. I'm sorry, one or the other. We have applied for grants, and we've received over $10,000 worth of grants for phase 1, and we have matching dollars to go with that from both the county and the city and the CID. And we have set aside the CID's matching dollars into reserve accounts. We've just done that this month. We pulled them out of the checking account. We put half in a money market account so that we can readily attach those funds as we're needed in phase 1, because we're moving rapidly along there now. And then for those that are longer term, we've put those in a 12-month CD and deposited those monies there. And we've also committed to the Board of Commissioners for SPLOST another $1 million, and we're working to achieve the goal of raising that $1 million and putting it into this reserve account as well. So that will take us about 5 years, maybe 6 years to reach that, but that should co-align along with SPLOST and when those funds are needed. Let's see. The project managers for phase 1, the contract we have says it will cost us $90,000 annually. We have spent, on our budget sheet that I provided for you, it shows that we have only spent $10,000, but that was as of January 31st. We've already spent another $20,000 with our project manager, and I expect that to grow because, as I said, we're moving forward, and we're moving forward fast, so now they're having to do more time and more work on this project. This week is a good, for instance, we have 5 meetings this week with individual property owners and with GDOT, and maybe another one on Friday if we can get that coordinated. On phase 2, we've received the grant for the PE only, and we do have those. The CID will pay all of those matching dollars, and we do have that money in our reserve account as well. The city we're asking the city for an equal match of $30,000, and the CID has budgeted the $30,000 in our match as well. And we anticipate this continuing until we get at least phase 1 and phase 2 projects done. Once we get those projects completed, I think you're going to be able to see our tax valuations increase, that we can begin to wean ourselves back from the Board of Commissioners. Each year we'll hopefully pull back that a little bit forward. I will say that as we've moved forward on this, and with the funding, the IIJA funding that GDOT has received, they so believe in this project that they've also put in 3 intersection improvements in what we term as our phase 3 at Adams Street, Industrial Drive, it might be Hannah Street's the 3rd street. And they're just going to go ahead and do those projects 100%, which is a little over $2 million each. And so we're pleased that they're taking our project seriously and moving this forward as quickly as they can. They've also, because the Board of Commissioners supported us and the City of Covington supported us to apply for the PE grant for phase 2, they've offered us a hard commitment of $7.5 million in the construction of the safety and operation roadway improvements for phase 2. So we're very pleased and happy that we have their support. So the leverage that we have on the dollars we're spending is growing, every year with the commitment from GDOT is they're including more federal and state funds in our project and along Highway 278. We have recruited new industries. I may have told you all this last year, but Starbucks was recruited for Covington Town Center. And when they looked at the demographics and they looked at the busyness, I'm gonna say, the bustling activity of Covington Town Center and Highway 278, they chose to come to Highway 278 enough that they bought out the non-compete clause from Dunkin' Donuts. So that's a considerable investment above their lease agreement and above their location site. And they chose that because of the work that we're doing on Highway 278. We also have a new doctor's office that's located and replaced the empty Synovus building at Mill Street. And I did tell y'all last year, but Bobcat of Atlanta chose that site because of the improvements that we have planned along Highway 278. And we have Mr. Boswick that owns Bojangles decided to invest nearly $1 million in renovating Bojangles and updating that business because he felt like we have a strong plan for our community and he wants to continue being a part of that. And not only that, but he also bought the parcel at the corner of Turner Lake and Highway 278 because of our plan and intends to put a car wash in there. Are there any questions that you might have?
Commissioner Mason.
Thank you, Mr. Chair. Thank you, Ms. Kathy,
Hello.
once again.
Good to see you.
I always enjoy hearing about the CID project. I think it is amazing. I've even kind of done research and looked at how CIDs have positively impacted other communities, just to kind of see how an expectation it's going to positively impact our community. A couple questions. With the current CID project, are there any pieces of that project that has been completed? And if so, what parts have been completed already?
The design is the only thing that's been completed to date. And you will all receive an invitation. GDOT will do a stakeholders preview of the design on phase 1. We are currently working on the design for phase 2. So that process will probably take us 12 months based on the phase 1 process. But we have done the design for phase 1. GDOT's waiting for their final approval, and we expect to have that stakeholders meeting late April or early May. We really thought it would be in March, but with everything going on at the Capitol and all GDOT's appropriation of IIJA funds, it sort of got pushed back a little bit. And our design for the portion outside of the curbs, we hope to have that ready by that meeting, so it will be there at the end of April as well. And that's the meetings we're having with some property owners that are gonna be impacted, and we just want them to know ahead of time that, you know, this is how it's gonna impact your property, other than just maybe we need a foot or two of right-of-way. But we expect that to be a positive movement forward, and we're trying to keep all of our property owners informed of what's going on ahead of time. Right. As soon as we get the PFA for phase 2 and we're in the GDOT process from the grant that was awarded, then they have to transfer the funding, and then they give us a PFA, which is a performance funding agreement. And once we receive that, we will start a meeting for phase 2. And again, those will be public open meetings. The commissioners will be invited to those because that will be basically, you know, a beginning effort there. And we will be able to plan those changes. One thing that's different on phase 2 is we will be doing all the design for both the street as well as for the improvements that in the sidewalks and the trail on that. So we will be doing the total design there.
Okay, and then I think I thought I just saw we're investing, what,
30,000, yeah, we're just
And-
asking you to help us pay for the project manager. We've hired Jimmy Garrison from Thomas and Hutton, and the reason we've hired Jimmy is he's well-respected in GDOT. So much so that when we have a meeting, if Jimmy speaks, GDOT sort of backs down, you know, when they're asking us stuff. So, again, I think that's experience more than anything else. And we want to be sure that everything we do follows the mandates of the federal government for these grants, for what our city and our county expects, what we expect to be delivered, and that we're using our tax dollars wisely, and also that we're, there's no question about how we're handling your dollars and how we're using taxpayer funds as either. So whether it's the money we receive from you or the money we receive from our taxes, we're meeting all the gap financial requirements and trying to make that work for us.
So the 30,000 contribution from the county is going 100% towards the project manager?
Yes, yes, along with the city, along with that, we are putting in 30,000 in our budget as well for that.
Okay, excellent. And then, of course, you know my last question that I asked about last year, and I know we've had brief conversations. You're aware we're in the process of getting ready to start widening Salem Road
Right.
this summer. At least that's what we've been told, that Georgia Department of Transportation is going to
It's
start it this
still
summer.
scheduled for that.
Yes,
So
it
so
is.
yeah.
So, I know you said you had spoken to the CID board about possibly incorporating a CID project over off of Salem Road, since we're going to be widening it. Do you mind providing me with an updated status, or have you all discussed it any further, or is that still something that's kind of in discussion, or?
It has been discussed on multiple occasions, I will say. Their biggest concern right now is we have everything we can handle getting phase one done. Once we get phase one done, then we know all the steps that are required and what we need to do. And I think they're not opposed to it. They just feel like we're learning the curve right now.
Right.
So it is something that we would be interested in looking at. Probably, I don't mean when phase one gets completed like 2027.
Right.
I think it's like when we start construction and we're aware of what's going on. Because this is such a big project for us.
Right.
But it is something that they would consider talking to, and whether that would be an extension of the Highway 278 CID, or we would take it as the Salem Road CID, or the Western Newton County CID, whatever name might come up for that. It's how do we structure that in Gwinnett County and in other counties. Not just Gwinnett, other counties that have multiple CIDs. Each territory has a different name, and it's all handled under the same administrative level in their counties, not necessarily under one CID umbrella, but each CID is handled under a CID department that comes through the Economic Development Office. So we've sort of talked about what they've asked me to do is go out and look and see how other counties have handled it.
Right.
So we can get a grip on what works best and what does not, and we can come back to y'all with an intelligent recommendation.
Excellent, thank you. And you're right, it's a learning process because this is our first CID project in our community. And so I'm excited and looking forward to this project coming to fruition so that we can incorporate other CIDs within our community as well. And I think you doing the research and finding that out now, I think it's excellent. So I just want to say thank you for even bringing this to our community.
And I do have two things that I forgot to mention to y'all. One is we're going to start right-of-way purchases after July, I think. It's if their FY year begins, and So you're going to see right-of-way discussions. You're also going to see utility discussions. So you're going to hear us talk about that some this year because we want to get everything ready to follow in the footsteps of GDOT's. They expect their construction to begin in 2024, July of 2024, which is next summer. So we want to have all of our stuff in order and ready to be able to meet their deadlines so that we can just roll right in. They're actually talking about rolling our project back into their project for construction. That won't be decided until we have all of our ducks and documents in hand, but we're hoping that will take place. And another interesting thing that happened is the state of Georgia asked all the CIDs to put their all their grants that they've received together in a spreadsheet so that they could know what projects had been obligated and what projects had been awarded grant funding. And our little CID, which is like the 8th or the 9th smallest CID in the state of Georgia, we were right up there, about 12th of all the 30 CIDs in Georgia with the grants we've received. So the CIDs that have a $40 or $50 million budget, of course, they had, those 7 or 8 CIDs had much bigger grants than we did. But for the next middle section of CIDs, we were at the top of the list. So we're hoping that that will continue to be the case and we will get our projects completed in a quicker way. And I met with Commissioner McMurray last week at the JDA, and I represented your Commissioner Marcello because he was at an accident that happened in the county, and but after the meeting was over, he spoke to me about the CID and how he supported that project, and he hopes we're moving forward, and how supportive he is of Newton County in general. So,
Thank you.
yes, you did a good job.
Thank you. I greatly appreciate it. Commissioner Henderson.
Thank you. Question that I have, can I call you Madam Chair?
Sir?
Can I call you Madam Chair?
Yes, you can.
Yeah.
Jason, you can call me
Yes,
anything.
yeah, I know. We go back a long ways. The roundabout, I'm not sure, were you more in that one, over here on Turner Lake, the roundabout, one with the flowers and stuff on it?
All right, there's a roundabout that's going to be, they're actually going to redo, and at this public meeting, I will be able to show you that.
Yes, ma'am.
I've not been
Yes,
given
ma'am.
permission until GDOT
Right.
approves it. So, but there will be a roundabout right at, just sort of in front of Longhorns, you know, right there where you begin to go into the ramp to get on I-20, or where Turner Lake Road comes around into there. That's one, and there will be there will be lanes that are defined,
Right.
so you'll be able to travel around them. And at Emory Street, the same thing. There'll be
Right.
some right-hand turns, so you don't have to go
Right.
through the circle. And but those are the two roundabouts. There is a signalized left-hand turn at West Street. So at West Street, you'll be able to make a left-hand turn from either direction. You will not be able to go straight across, but I do think that we've convinced them that the median will be level so that ambulance, fire trucks,
Right,
and
correct.
emergency vehicles
Correct.
can go straight across, but not just
It's not just regular traffic.
yeah, and there will be, we've added crosswalks at West Street, at all the roundabouts, so that pedestrians can cross over the street. And we've added one right at the roundabout going to, in front of Longhorns, going into the park and ride lot. I mean, it will go through that grassy triangle that's there now and take you all the way over to the park and ride. So if you catch a van at the park and ride to go to Atlanta and you want to ride your bike there, or you want to walk there instead of driving your car, you're going to be able to get there safely. And that was our priority if they were making those
Right.
changes. So, because there's a lot of people
Yes,
that walk
I
there.
agree.
They don't have a vehicle, or if they do, they
Right.
limit the use of it, and,
There's a lot of homeless people in the area too. But the
So-
reason, yes, ma'am, the reason why I brought up roundabout, I was thinking that during your tenure as chairman, you set a standard with Turner Lake. It was just a beautiful roundabout. And I was hoping we have something similar in those roundabouts over on 278. You know, it may
Ye-
cost a little bit more maintenance for them, but I think it's very important that this would stand out, because a lot of people who don't know anything about Newton and Covington, Newton County,
yeah.
will pass by them or use them, and it tells a little bit, oh, so it shows a nice roundabout right here.
Yeah.
And so I'm hoping that we continue to do that. in all
Yeah,
our
the
roundabouts.
city of Covington has a project on Turner Lake Road that's part of SPLOST, and it's gonna add another lane to that roundabout in front of the Turner Lake Park, and widen Turner Lake Road, as well, all the way to Washington Street. So, the only reason I know that was because they had to make a few changes at Turner Lake Road with our new design, so that, you know, all the lanes aligned, the traffic flows smoothly. Roundabouts have proven nationally and internationally that they're a safe option. It does two things. It slows speeding traffic, and it allows people not to stop at a red light, because we citizens lose $10 million a year stopped at each red light on 278. That's been tested by GDOT. That's been proven. That's a number that they provided to us, and that's only going to grow exponentially. And then if you have a wreck, if you have pedestrian hit, that just expands even more. So we're hoping these will create a safer highway and a more pleasant highway to travel upon, and boost our economic development along the corridor and in. We hope to expand and grow here, as well as look at other spaces that would be great areas in the county.
I'm glad you said that, just real quick, Mr. Chair, because I think that's good to know that we're losing $10 million a year because of accidents, stops, all of that, and it's not flowing appropriately. And I'm certain that that's the same situation as Salem Road.
Oh, yeah.
I
Yeah.
mean, that's a huge concern that I hear from residents that's on the western side of the county, is that Salem Road traffic is horrible, it's bad. And so anything that we can implement to kind of help with that,
Yes,
that flow, like I mentioned before, I know before we had the roundabout at Salem Road and Highway 81, it was always backed up. Now, free flowing, I don't see many accidents, I don't hear about any issues with the traffic. And so I did research and I saw that it did help prevent more accidents, but knowing that $10 million number, and like you said, it's going to increase as the time our population increases, that number's going to increase. And so we want to make sure that we can eliminate that number as much as possible, and this will help.
And the maintenance cost to a roundabout is equal to the maintenance cost of traffic signal. I mean, you know, you've got maintenance that goes with both of them. I remember when I was chairman, one of the big issues we had was we were always going and recalibrating the traffic signals, because all of a sudden you'd get up in the morning and it would take 10 minutes for the light to change where it should have been changing every 2 minutes. And you know, but you only had the engineer that could go do that, and it was taking hours of his day where he could have been more productive other places. So that's one of the reasons that I signed on to champion roundabouts. But yeah, it's I think it will be good for our community.
Well, listen, we greatly appreciate you coming today and presenting to the board, and we appreciate all that you do for the community.
And if you need any other documentation from me, just have Brittany let me know, and I'll provide it. And you know, hopefully, we'll see you at the presentation for the project development and concept approval. So, Or if not, I can, at that point, I can send you a copy. So,
Thank you so
provide
much.
it here. Thank you.
Thank you.
Up next on the schedule, we have Alcovy Casa, and they are requesting $16,625, and their information can be found on page 100 of the book.
Good morning. Good morning.
So I know that you guys heard both of our juvenile court judges yesterday, and I talked briefly with Judge Edgar. After she left here, she came over to our office to help us with the training with some CASA volunteers that we have going through. So I know you guys heard kind of some of the alarming statistics of where we're expecting our numbers to grow. I think as Newton County grows, I think our foster care numbers will grow. And what we've seen on our end is, I've been with CASA since 2008, and the amount of cases has obviously gone up if you look at the numbers, but also the intensity of the cases has gone up. We have children hospitalized in residential placements with really high needs more now than ever before, and data tells us that's just going to continue. So we are having to spend more of our time, training our CASA volunteers on kind of some of those higher needs. In 2008, we were worried about making sure they had good grades. Now we're trying to make sure they're safe in a whole lot more ways than just academic. I think all of you know who CASA is and what we do. I don't want to give you the same spiel that I give every time, but a couple of things. I think everybody yesterday, like late afternoon, should have received in their email. We're redoing a project that we did last year. You probably have seen it on the square, on our social media, the I Am CASA Ask Me Why. And this was a really great campaign that helped us bring in more volunteers. It was a really great way, especially in the pandemic, where we couldn't go do public presentations, to get someone's story out. And the story that we opted to tell was the CASA volunteer, because that's who someone knows in our community. You can frequently say our CASA volunteers' names, and everyone's like, oh, I know who that is. I know who that is. I go to church with them. I'm in Kiwanis with them. However that plays out. And I would love to invite you guys out to participate in that as well. All of the information should be on the email. If you don't have it, let me know. I'm happy to resend it. Sometimes constant contact isn't always our friend. But we would love to have you come out and participate in that. And part of what we're doing in that is just showing the community that we have the support, and we want to continue doing more good as we continue to strive for our goal of 100% of children that are in foster care having CASA coverage. Some of the information that I just gave you is the benefit of having a CASA volunteer on a case. These kids find permanency faster. They're able to not come back into care. They're more likely to have a significant emotional attachment. And sometimes that person isn't necessarily the CASA volunteer, but that CASA volunteer is making sure that child has that long term, after they've gone home, after they're adopted, after they're with grandma permanently, which is the long-term benefit of that. I think the last thing that I would really like to tell you guys is we're turning that visitation, the old library in the Cousins Middle, into a visitation center. We've had maintenance come out. They've given us one quote. We have somebody else coming out to do a quote, and we're super excited about offering that. There is no one else. We work by judicial circuits. There is no one in Newton or Walton that offers a visitation center for our kids. What we know about visitation is it's not about necessarily the time that children and parents have together. It's about the quality of that time. Currently, if you have a child in foster care and you're going to go visit your child, you're sitting in a literal DFACS office, like with a desk, with a chair, with a computer, and you're trying to entertain toddlers for 3 hours in an office. No one's going to be able to spend quality time, and it becomes very disheartening, and parents stop showing up because they feel how disheartening that is. We have the opportunity, because of the space that you guys have given us, to really increase that opportunity for them, to give them that quality time, to put in the two-way mirror. So the person observing to make sure everything is safe is sitting where they're not even having to interact with that child. They're sitting in a safe space to be able to observe appropriately, and interfere if necessary. The science is new, but the science is very positive on quality visitation is the #1 indicator of parents being able to regain custody of their children. Parents that regain custody of their children tend to keep doing well because they have the supports in place. They frequently work their way out of poverty, which is not an easy task, but they have the supports to do that. While their children in foster care, they can usually work more on their education, work on their substance abuse issues to safely reunify. So in working with the One Newton goal, this is going to help with our poverty issue in Newton and Walton counties. And I would say 95% of our cases are poverty cases in Newton and Walton. That's not necessarily the reason that they came into foster care, but it's a complicating factor around abuse and neglect. But again, I know you guys know who we are. I'm happy to take questions, but I also know you have a packed day and I won't take all of the 15 minutes.
Well, I'm gonna start it off. I know Commissioner he raised his hand first. Let me come to you. But we know we live in a different world now, and kids are seeing so many different things. We appreciate you guys on a whole different level than you can ever imagine.
Well, thank you. I appreciate that.
You know, living in living in an area that, you know, we see it all the time. So we're just thankful for what you do.
Well, thank
I'm
you.
gonna go to Commissioner Henderson. He was first.
Yes, sir.
Yes, and I too concur with the chairman. We thank you for what you do. We know that in the Splash, the Splash committee had turned down the improvements, and so the commission took it upon ourselves. We took it upon ourselves to add it back on Splash in terms of about $8 million more, or $8 million to do something.
Mm-hmm.
And after having meetings, we find ourselves in the same, at least from my perspective, the same situation that we had beginning about possibly the old plans pushing down the middle part of Aura Cousin, saving the front part for historic value, and then maybe possibly saving the back part or DMV it so it kind of looked like it. But I learned that during the whole conversation, that's about $11 million more, which I think is a total about $19 million.
Wow.
And so I couldn't understand why we are back in the same situation, but what I proposed was that let's just go and, what I will propose is let's just go and clean and renew, remodel Aura Cousin from the front all the way to the DMV, save Costa, like we originally said we were going to do, you know, the space, what I'm saying. Push down the back end, and then if the commissioners or a commissioner or commissioner can come up with the other $11 million, build on a 2-story building on the back side of it, if we can come up with it. And from my being at meetings, I don't think that'd be hard to come with another $11 million, considering all the other stuff in our county that's going on in all the districts, that we would spend an additional $11 million. But hey, I'm open for anything. But I don't want, and I remember you coming here and you said, well, don't push it down. You said, well, we want to continue to have our space. And we came over and looked at it, and it was a beautiful space, a lot of space where, you know, a lot of families, kids could come and kind of reunite and help them. And so I want us to do what we said we were going to do. From Costa all the way back, there might be a change or push down or whatever. And from Costa all the way up to the front, keep it and remodel the old cafeteria so that it can be of some use or whatever that the community as a whole come up with. So I don't want to move backwards. I want to move forward. And it's easy to sit up and talk, and that's just me. You can talk about it all day, but if there's no action, it's dead. So that's where I'm at. I want to keep it thriving. Not only for that juvenile part, piece of it, want to remodel those, all that over there, keep all that in place. The only thing that wouldn't be in place, what we had suggested, would be the election piece.
I'm sorry, the what piece?
Ma'am?
Could you repeat that? I'm sorry.
Oh, the election piece, I was thinking on the front side, there's a storage area for the city, because they have storage stuff in there from whatever they have. And we wanted to remodel that so we could put the election equipment, you know, the computers that we vote on in there, and the climate control, because they said that'd be climate control. And so, but now we don't think about that because we may have we may be looking at another piece of property. So, so we just want to bear in mind, I don't want to see nobody move. And so I'm open, transparent, won't cost and all other people, because I request a list of everybody that's over there so we can know where they stand and where they stand and how the building may change and how we may use the $8 million and how if we get 11 million more, how it may be spent on restoring that building.
That's fantastic.
Thank
And I encourage it, I know we have talked about this as well, but just next door in the Piedmont Circuit, there's the Wimberley Center. And they took an old middle school that was similarly aged and revamped it. And I know their building might be in different condition when they started than the old Cousins Middle School was in, and that's not my area of expertise. But I know it has become just an amazing resource for that community to be able to go to one place and get all of the services that they need.
Absolutely.
When you're talking about folks that have limited transportation, it's really hard. We get knocks on our door all the time, even though if you've been over there, you've seen all of our CASA stuff at the front. People think we're the DMV. Frequently have folks come and knock on our door and think we are DFACS, and they're actually looking for DJJ around the front. But we've also had kind of the reverse. We've had people leave DJJ, come over to our door, and just sob. Like they spent all of their money getting their kid to their probation meeting just to find out they had to figure out how to get across the county to DFACS. And that's not something we can help them with necessarily, but we can listen. And I really think having more community resources in one centralized location would be a fabulous resource for so many of our families. I mean, I know I'm annoyed when I have to get out of my very comfortable office and get in my very well working car and drive over to DFACS for a meeting, but I can do it. It's not a financial burden for me. It's not a time commitment. I'm not having to walk. And so I can't imagine the stress of that on families.
Thank you. Commissioner Mason, thank you.
Thank you.
Thank you, Mr. Chair. Thank you again for what you do and the work that you all do at Alcova Casa, because it is very important. Kind of like Chairman Baines alluded to, we see it all the time. And of course, for those of us that have children in school, we see it even more so because our children are being exposed to things that we are having to guide them and direct them and instruct them.
I'm a parent, I understand. My children are in Newton County schools. Yes, sir.
Yes. I have 3 of them in Newton County schools, and about to be the 4th as of next year in Newton County schools. And so I get it, and I see a lot. And so it is so important, this area of work. I still have to get over to see the new location because I still have not toured it yet.
Well, come on over.
I know. So
I think you have everybody should have my cell phone number. It's on our business card.
I do.
But please call and text. We're frequently in meetings. There's only 3.5 of us technically that are over there.
Okay.
So sometimes when people come, the door is locked. Well, the door is always locked to just safety. But text me before you come or call and make sure you get to come see it.
Absolutely.
It's really fantastic, and I would love anybody to come over and we can show you what the plans are for the visitation room. We're going to be looking, we're in beginning stages with the visitation room, but we're going to need somewhere around $70,000 to $80,000 extra per year to apply that staff member that is going to be key and crucial to the visitation center. It'd be a full-time person dedicated just to that. That would be the person scheduling visits. That will be the person who is observing visits, and also the person that is going to testify in courts. That would be the expert in attachment, bonding, family reunification, so they can adequately give evidence-based testimony, factual-based testimony to our juvenile court so they can know how to proceed safely for children. But please come over. I'm really excited about the visitation center, and bless you,
Thank you.
and the direction that CASA is headed. And I think opening the Visitation Center will draw more community awareness and support, and we can hopefully recruit more volunteers to be CASA volunteers through that.
Okay, excellent. And thank you again. My only question was, I saw there was a $959 increase that you all were asking for from the previous year. What is it? Because I didn't see any details. What would that kind of help cover, if you can recall?
We haven't, long and short of it, just kind of the cost of increase of continuing to grow a program.
Right.
As we continue to grow a program, we're going to need more staff.
Yeah.
And the 10% raise of less than $1,000 just kind of goes into helping some of the starts of those items. I mean, obviously, that's not a salary, that's not all those issues, but mainly going towards the cost of business increases that we've all seen and experienced,
Right.
and continuing. One thing I really love about Newton County funds is a lot of the Newton County money that y'all give us goes right back into Newton County.
Yeah.
With a lot of our advertisements and community awareness, and it would up that as well.
Excellent.
So it would go right back into the community,
Right.
really.
Excellent, and that's always great to hear that
Yeah.
those funds are going right back into helping elevate our community
Yes.
in
Yes.
whatever capacity that it can.
We have grants, we have federal grants that do a lot of great salary work for us. And they're fickle, I'm aware, but Newton County money is really a very special thing because it gets to be used back in the community.
Good. Thank you. That
Thank
was
you.
my only question.
All right.
Any
Thank-
other questions?
Thank you so much. We greatly appreciate you
Thanks.
and your team. Thank y'all for
Thank
all that
you.
you do.
I will let them know.
All right.
And really do look in your emails and please look for the I Am CASA Ask Me Why. Please come out, or encourage someone to come out from here, because we'd love to show the commissioners supporting CASA in the community to help you guys gain support as well. And thank you for all of you do. I always love coming and sitting and listening and learning. Like, I didn't know a whole lot about CID, but that sounds fantastic.
Yeah,
So
it
you learned a
is.
whole lot. Thank you so much.
Thank
You're
you.
welcome.
I am CASA. Ms. Brittany.
Up next on our schedule, we have McIntosh Trail, and they're requesting $4,000 for the FY24 budget, and they can be found on page 112 of your workbook.
Good morning.
Morning.
I'm Elaine Brown. I'm the executive director, and I've had the pleasure of coming before you several times. So I appreciate your patience and every year giving us an opportunity to come to you and talk about our program. So I don't talk about more than you want to hear. Do you want to ask me questions, or do you want me to tell you a little bit about McIntosh Trail Early Childhood Development Council? Would you like for me to start off that way?
Yeah, yes, if you can, and just tell us a little bit about what the monies that the county give is utilized for.
Okay, so you want to know for the requests this year? Okay, I can do that. Every year we've had the opportunity to request different things, and we try to make sure that it's something that's relative to our needs for the center in this county. We serve 120 children and their families, and we probably have, I should have counted this up, but probably about 25 to 30 staff in that center. It's at 25 Lovers Lane, and it's our largest center that we have out of 7 counties. It's a 25,000 square foot center. And like everyone else, due to COVID, we have had a lot of trouble having enough staff that are qualified. And it is beginning to get better. And we saw this trend starting back right before Christmas, and I'm thinking, we're getting applications that we, and even had staff that, had quit due to COVID that were wanting to come back. And so we looked at, a lot of times people put in applications because of word of mouth. They hear that that's a good place to work for, you know, or either they say, don't go there, you know, they don't care about you, they don't pay you enough, et cetera, et cetera. So we've looked at what can we do to make all of our staff want to stay or want to come and put an application in for prospective staffs. And down through the years, I have read several surveys and studies that have said, when you survey people that work for you, what is it that they want is most important to them? And you might off the top of your head say, well, it's money, it's how much you get paid for the job you do. But that doesn't keep them. It may bring them in because they think you pay well or you pay enough for them to have a living. But what keeps them and what makes them want to stay and what makes them be able to encourage other people to put in applications is if they feel valued. Do they feel like the people that run the agency or the business or whatever, do they value as a person? And then do they value you as an employee? So the Office of Head Start, and you hear this all over the news, I know you do, about wellness, resilience, you know, how are you feeling and how are you coping? So we looked at how can we make our staff in this county feel more valued. And one of the ways, we have a large classroom that is empty. It's a huge class. The classrooms in those buildings are really big. And we would like to turn half of it into retreat area for individuals when they're on their break or they have the opportunity to go eat lunch, or even when, you know, we tell people to leave your family troubles at home, but you don't do that. I mean, you may put it to the back, but you've always, if you've got family issues, you've always got it in your back of your mind. So we want to take this classroom and take half of it and make it into an area that will allow staff to come in there and have a quiet time, a quiet place to either just think, mull things over, pray, whatever they need to do. And we want to do that by being able to put a couch and a couple of chairs, maybe end tables, and maybe a library area that we can put resource information in there. Not about how to teach the kids or anything like that, but about how to deal with life and to keep yourself strong. So we want to do half of the room with that, and then on the other area we want to put a couple of tables and some chairs and make a space that if they need to have a staff meeting in that area, or they need to have a group of parents meet, or they bring a consultant in that might be working with a couple of staff or whatever, that they'll have that space over to the side and that both groups can coexist without, you know, really interfering with what's going on. What we hope that this will achieve is that the staff will feel like, hey, they care about us enough to give us a place to have our own quiet time, our own time out, and that they will begin to feel like we're listening to them, because burnout, I mean, this time of year you hear from everybody burnout. You know, we've been through, you know, so much burnout. So we feel like that they will understand we do care about them, and that they'll be able to tell people they know in the community, you know, this is a good place to work for. They care about you, they listen to you, and they do what they can to try to help you cope. We hope that it will decrease turnover.
We had several employees that left during COVID because they just didn't want to come back to work. And, you know, we still, in our job setting, we still require masks, which we hope in the next couple of months that we can do away with. So we want to be able to decrease the turnover. And when we decrease staff turnover, that helps keep staff in a stable position that they're working, they have insurance, they have benefits, they have people. We provide mental health consultants that if they want and need to request an appointment with one of our consultants, they can do that. We hope that attendance of our staff will improve and stabilize, that they'll want to come to work and they won't say, well, I'm going to be a few minutes late or whatever. So we hope that it'll stabilize that. And then when you have happy teachers, happy staff, and this includes kitchen people, janitorial people, family service workers, when you have people who are happy with their job and are glad to be there, then the children are going to benefit from that. They're going to benefit from a teacher who's not coming in, I don't want to be here, oh, I hate this job, to a teacher or a janitor who says, I love this job, and I'm so blessed to have this job because they listen to us and care for us. How it's going to make your county better? The children that we serve, 90% of them are low-income families. At least 10% of our enrollment must be children with disabilities. If we can, number one, get those children ready when they go into either another pre-K program, we have one here, or they go into kindergarten, ready to learn, because we have children who have come and they've never owned a pair of scissors, or they've never, I'm talking about, you know, the good kind of scissors, not the pointing ones, or they've never had their own pack of crayons. If they've never had anybody say, you know, you're a great kid and I am so happy you're here. So we want to have the children, the staff able to help those children to be ready to go into y'all's public school system. That way, we don't want to send children to you that we've not helped them deal with their issues or problems. And we want parents to understand, you know, if you've got a place in there, if you need to talk to a family service worker or you need a minute, this space is here for you also, because if those parents don't value an education and they don't understand how to be a teacher to their own child, then y'all are going to inherit that. So that's going to help prepare the children and families to come into your school system valuing education, feeling like they can learn, that they're smart people, smart kids, and when they graduate, then they're going to be a good tax base for this county. So I have been with Head Start since 1976. A long time ago. Some of y'all were not even born then. So I've been with, since 76, and I've been with this agency. We were incorporated in 1982. So,
Wow.
I am blessed that I was able to go to work for Head Start. My family was blessed. My children, my husband, people around me were blessed because I got a job with Head Start many, many years ago. So I will take anybody to the floor mat if they want to talk about Head Start. So.
Well, listen, we appreciate, yes, sir. We appreciate your service to the community.
Thank
and
you.
the community, all the communities that you have made a contribution to. I'm going to open it up now for a couple of questions.
Okay.
Commissioner Henderson, go ahead.
Thank you, Ms. C. Where did we move McIntosh from? Because we know we moved it from somewhere in over to off of 81, 162.
I'm sorry, I didn't understand your
I'm
question. I
sorry,
have
I'm
hearing
talking low.
aids.
Yes, ma'am. Where did we move McIntosh from? Man, it used to be at one place here in Covington, then we moved it out to 81 and 162.
When I first started, you're talking about the facility, the
Yes, ma'am.
locations? Okay, I can answer this. I can answer it back as far as 76. We used to be in the basement of Bethlehem Church, not too
Yep.
far
From here,
that way.
that way.
Yeah, we had to, on Friday afternoons, they had to pack up everything and put it away, because they would have church on Sunday.
Yes.
And then on Wednesday, they had to do the
Yes,
same
ma'am.
thing,
You're right.
and then unpack. Then they told us that they needed that space, so we went to the youth center. But somewhere along that line, we were, for a little while, in the armory maybe.
Yep.
And then we went to the youth center, and then we went over to, it's like a mall strip, there on Turner
Turner
Lake Road.
Over by the,
And then he built, I can't think of the gentleman's name, he built us a building there close on Turner Lake. And he kept going up on the rent. And so,
Mr.
That
Spiller.
sound familiar.
he kept going up on the rent. And so,
Mr. Spiller.
we bought that facility on 25 Lover Lane. I think it started out as a skating rink, and then maybe a church somewhere along the line, and then it was turned into a daycare. And
Correct.
then we were able to get funding through the Department of Agriculture to purchase that building.
Yes, ma'am. And I remember that when, just almost as if it was yesterday, because it came before the Board of Commissioners, he had to get the zoning, because even though he had been a daycare, he still had to do some kind of zoning, and it seemed like we just never could, our staff never could kind of get the zoning so that y'all could move in it at that particular time. But we worked, not myself, the board as a whole, we worked so that y'all could move in that facility. And Mr. Johnson, he was the champion for that facility. And I can see him there up in. And so, but we'll make a long story short. I just want to say this. All of my kids went to McIntosh. And some did good, and then I had others did real good. We had our youngest son, who's typically a young person, the young person in your family get the benefit of everything, of all your learning during your life. And he graduated from Georgia Tech, and he
Yay!
got a degree. So, but and it's been very instrumental to this community from McIntosh, because it was a place where we could take our kids at no cost and get good help in learning them, being around people, being around other kids. And so I think, and I said all that, just said this is what we have got away from. We need to bring in more institutions that nurture our children, because we need the help.
I know.
Look at TV. Just look at TV, and it may be just only the bad news.
I don't like to listen to the news anymore.
Well, yeah, it makes you, but you have to, because you find out sometimes it's your neighbor across the street. You
Yes.
find out sometimes your neighbor over on the other side of town, and you find out sometimes it's right in your own community
I know it.
that you may not know. So, but it's a good source of information. But I think we got to have a change in our community, in the mindset, especially where we for our kids. And I thank you, because
Thank you.
you had the right
Thank-
idea a long
Thank you.
time ago.
There's some expansion money coming. We've been told it's coming down for early Head Start. Of course, that can be like a 2-year process or longer, but we will be applying to expand the number of children we serve in early Head Start. And I know you remember Sandra Hollinsworth. She was a center manager for years and retired. For the last 4 or 5 years, she's been working in our inclusion classroom in Spalding County, which was the first inclusion classroom in the state where Head Start put a classroom in the school system, and they provide a teacher, and we provide, they provide a certified preschool special ed teacher, and we provide a teacher and aide. And Sandra has been at that third person in there for about 5 years. And those children are 3-year-olds, and the majority of them are children with disabilities. And we keep telling her every year, no, you cannot retire. So she came back to help us out. So,
Commissioner Mason.
Thank you, Mr. Chair. Thank you so much for your presentation and for this area of work. You are looking at a county commissioner who is a product of Head Start early education. Back in Tulsa, Oklahoma, my mom still has photos of me in the family photo book of when I graduated from Head Start in Tulsa, Oklahoma. And so when we moved to Newton County, back in 2014, my 2 older children were already beyond the Head Start point. But I got an opportunity to, I learned about McIntosh Trail back in 2019. Well, at that time, I had a 2-year-old, soon to be 3. And so we got an opportunity to introduce him to McIntosh Trail back in 2021. Thoroughly enjoyed the culture, the environment. I mean, he just really loved it. And when he went into pre-K, he was already advanced just from what he got at McIntosh Trail. And so I currently have a 2-year-old, soon to be 3-year-old in May that will be at McIntosh Trail next year.
yay, yay.
And so I'm a firm believer in Head Start early education. I think it is so important. I just look at my tenure, starting in Head Start and, now being a college graduate, being a county commissioner, just what that Head Start did for me at an early age. I wanted to ensure that my children got that Head Start as well. And so I just want to say thank you for the work that you have done and are doing in our community. And I will always be a cheerleader and supporter of McIntosh Trail because of the work that you do and how you truly prepare our children here in Newton County. So thank you.
Y'all make me feel so good.
You're welcome.
I
Listen,
just-
we greatly appreciate you and again, and all the contributions you have made to not only Newton County, but other communities that you have served as well. So we greatly appreciate you.
Thank you. You have an excellent program here. They're quality rated. We were the first Head Start in the state to start that process, and all of our federal reviews have been completely in compliance, and I can't brag because as a staff, I just sit in my office and try to direct things to happen, but we're known as one of the best in the state, probably the best in the Region 4, which is 8 states, and we are a national program of excellence and achievement. So, but it's the people in the centers that do the work. So, but thank y'all for supporting us and being so positive. And Cassandra would love for y'all to come visit. We're closed next week for spring break, but call her and let her know you're coming, and to make sure we're not closed for training or something. And she would love to let y'all come in and read a book or something.
And I try to stay in contact with her as often as I possibly can.
She's doing an excellent job.
She is. She is.
Very smart lady, doing an excellent job.
doing a great
And she
job.
was a Head Start child.
Really?
She, her sister, and her mom worked for Head Start. She was in the kitchen, Hazel, and we encouraged her to get at least a CDA, and she did that and taught for a while in the classroom, and then she decided she wanted to go back to the kitchen. So I said, I'm with you. So, any more questions?
No, we greatly appreciate you.
Thank you.
Thank
Thank
you.
you all. I appreciate it. And
Thank
y'all
you.
have a nice week next week.
You
Thank
too.
you.
So hopefully it'll be nice
Yes.
without the pollen. Thank you.
Right. You're welcome.
Guys, I'm gonna take a quick restroom break. Thanks, restroom. morning.
Good morning,
Good morning.
Chairman, Commissioners. First off, I want to apologize for not being able to make my regular scheduled meeting, but I left at 3:30 this morning to make this meeting, so just have got back in town. And Brittany, thank you again. I know I personally thanked you, but I want to publicly thank you. As far as the fire service, I'm gonna be honest, I'm pretty sure we, like every other department in the county, we've got an increase. My staff and I have went through, we've looked at this budget. I mean, we've cut areas we could cut, and we've got some increases in some areas. But our increases we're asking for, I'm gonna be honest, they're kind of out of our hands because of the fact that we're growing, we're putting new people on, we got to equip, train these men and women that are coming into the fire service to protect our citizens. I think we held it as close as we could. I mean, by my calculations, we're only asking for a little over $2 million increase from last year. And there's a couple of them, like I say, that I just want to touch on because I know that talking to Miss Brittany, she said some of them, y'all might even have questions, and I'll be glad to answer any of them, but I just wanted to kind of highlight a couple of them. One of the biggest ones was, technically protective clothing, PPE, and uniforms. Those dramatically went up, but with the cancer initiatives, we're trying to give all our people 2 sets of gear so that if they're at a fire, they can bag up their dirty gear, put it on the truck, and they'll have clean gear. More people means more uniforms. But another thing also in our PPE, unfortunately everything in the fire service has a life expectancy. We're losing a lot of gear this year that's going outside its 10 years of lifespan. So technically we cannot keep those people in that gear. So we really had to drastically increase our PPE this year, but it's to protect our people for the job that we asked them to do. There was one that I know Shree kind of showed me. There's one item that went up 1,000%, and it really didn't go up. This was actually had been classified in the wrong area. We have 3 of our stations that are on LP, and it was being picked up in natural gas. Well, LP and natural gas are 2 different things, come from 2 different vendors. So we had to move our LP for station 5, 15, and 2. Those are serviced by Loyal Gas, so we put them in the proper deal. And so where we'd only been putting in a few $100 to buy propane bottles for the training center, we actually put 3 stations that usually get LP delivered 2 to 3 times a year. So that is, like I say, when you look at over a 1,200% increase, you wanted to know why. And so that was one of the biggest ones. Another one that we looked at, I know that we had pulled fleet maintenance to vehicles out of our budget, and all that went under fleet, but we've had some new vehicles purchased, and we had to have emergency equipment, radios, lights, sirens, this and that and the other. Talking with Matt at Fleet and Miss Brittany, technically we have to pay for it up front, and then Fleet will pay for it after that. So that was a pretty big increase in that, because last year there was nothing, and this year there's several $1,000s, but that's to buy the emergency equipment for those vehicles that have been purchased either through ARPA or SPLOSH funds. So we've got to get them ready so we can put them on the roads. Everything else, we had slight increases in a lot of our line items, but again, it's just due to more stations. We've had the privilege of, a couple of new stations that are going offline as far as warranty work. We're having to pick up stuff there, so repair and maintenance to buildings kind of increased a little bit. Supplies had to go up a little bit because we got to put cleaning supplies in there. But With that, if there's any other things that y'all would really like to ask, I'll be glad to answer those questions, but I just want the board to know that we as a department, we really sat down and we cut where we could, but there are just the areas that are showing increases are really out of our control due to the county and the department growing.
Thank you. Any questions, commissioners? Commissioner Mason?
Thank you, Mr. Chair. Thank you, Chief.
Yes, sir.
It's good to see you guys. I had a couple questions. One, I saw increase in maintenance agreements. What is the maintenance agreements increase?
All right, maintenance agreements, that is, again, vendors that we do door maintenance at our stations, they're having to pick up two additional stations, now actually 3 if we count the forestry building that we are occupying now. It's not open as a station yet, but we're using it for storage. Our pest control, we're having to pick up, additional stations. What else all falls next? Oh, and the biggest thing in this, we use a reporting platform called Emergency Reporting Systems. They have been sold out, so we're having to get a new reporting software. That's $65,000. That, again, is a new platform that we have no control over.
Right.
This is something that we have to fill out to reports to the State Fire Marshal's office. So that was the biggest thing in there. Our vendor that was our reporting software company, they sold out, and this is a new software vendor, and so that was the biggest one, $65,000.
Thank you. I'm not sure what public safety citizen is.
Okay.
It's it went from 10.6 to 95,000.
That's Franklin, right? All right. This is our pub ed educator, James Franklin, who does a lot of stuff for senior services as far as educating the elderly. Also, he does stuff in the schools. He has asked for some new training props and aids, and he also conducts fire safety classes for individuals. He goes to birthday parties, and so he's just asking, again, for some additional training props and aids. And again, we're hoping that that would benefit him to, take his work out to the public at a higher level. But a lot of this is just training aids and training props that he can use to teach our citizenry, our elderly, our seniors, and our citizens in his day-to-day functions as a fire safety educator.
And then the small equipment went from 110.6 to 187.6. Is there small equipment you need to purchase now?
All right. A lot of this is also equipment that is going out of date, but we've added new, they're called thermal imagers, but that's a special camera we use to kind of detect heat. A lot of those are going out of date. They're actually, the warranty is actually going out on them. They were 5 years. They're going out, and we're looking at updating those units to try to maybe replace them and get them where where they're covered under warranty again, instead of having to pick up. But if we can't replace them, there's going to be an increase because there's yearly testing that has to be done on those. There's gas monitors that have to be tested yearly. And probably one of the biggest things in that also is we issue all of our personnel their own SCBA regulator, and those have to be flow tested every year. And we're up to 184 regulators now that have to be tested, and I think they're $54 a pop. So with the additional equipment and the required maintenance, that cost went up, and it's just mainly to keep the equipment that we give our men and women in the department, make sure that it's safe for them to use.
And then one last question, the $245,000.
And also, Commissioner,
I'm sorry.
Sheree did, we made the expansion at the offices, and that's also going to be some new computers for personnel.
Okay.
And we're actually looking at updating our computers in our fire trucks, going to a tablet versus an iPad. Instead of a laptop, going to a tough book.
Okay. And then I know we talked about, or you mentioned that we have some ARPA funds and SPLOST dollars going to help with vehicles, but I see $245,000 here in vehicles as well in the budget.
All right.
So what will that 245 go?
Technically, we requesting 2 more inspectors. That would be vehicles for them, but also in this is we've got a need now with all the trails opening up. We've had a couple instances on the trail system where people got hurt. We've had fires and we have no vehicles that will respond on those trails. And so in this, there's a UTV in there that would give us access for whether it be an EMS call or a fire call on the trail system, for us to be able to handle emergencies on the trail system, because right now we have no way of accessing the trail system except by foot.
So when you say UTV, what is that acronym?
Utility vehicle. It's kind of like
Okay.
a Gator,
Okay.
Instead of an ATV like a 4-wheeler. This is
Yeah.
it's a UTV. It's a utility vehicle, but
You educated me. I didn't
it'll in the bed we can either put a fire pump in it to fight fires, or we can put an EMS bed in it, and that way we can access, and if somebody gets hurt on the trail, we can actually extricate them off the trail by changing the bed in this UTV.
So it's small enough to actually go
Yes.
in the trail?
Not much bigger than a golf cart.
Okay, makes sense. Well, that's all the questions I had. Thank you.
Thank you, Commissioner Henderson.
Thank you. Well, first of all, thank you for what you do. I know, man, you've been running here lately. Yeah, when you first walked in, I said, oh, he done ran out of his uniform. Question what I wanted to ask you was, the gentleman that you were referring to that goes to the senior services, et cetera, could I get a list of my schedule of the events that he will be participating in or doing something for somebody? Because I was thinking that'd be something good for me to kind of attend some of those events.
James, he usually
Yes,
posts.
ma'am.
I know. We'll give you access to our departmental calendar.
Okay. Miss Jackie, give it to Miss Jackie for me, please. Please, ma'am. Thank you,
Okay.
sir. Thank you, ma'am.
Because he posts a monthly calendar of what he's doing.
Thank you, sir. We greatly appreciate you.
Thank y'all, and once again, thank y'all for allowing me to come in at a non-scheduled time. Y'all have a blessed day.
You too, sir. Thank you.
We're going to move back over to the appropriation book now. And
Okay.
up next will be Newton County Family Connection, and their request this year is $25,000, and their information can be found on page 138 of the book.
Good morning.
All in favor and not have a PowerPoint.
Okay.
If that's good morning, and I want to thank everybody, particularly Brittany, for the support that you have shown and your staff, and I know you've had a loss amongst your staff, and I send my condolences. And we've had a loss in the county of someone who was just dear to my heart for many years, and I'll tell you, when Clara Letts, the tornado hit her facility, it was Jody Nolan who convinced the Red Cross to come in and help the people who live there, because I worked for the Red Cross when I first met Jody, so we supported the firefighters and what they did. However, so I've known him for many years, but he was the one who said, yes, the Red Cross does, and the Red Cross specifically is disaster related.
Yeah.
But they do not help people who are homeless, because there's a host of issues that come with that, with helping that people. And the thing that Jody was able to convince them that, yes, they were homeless, but also they were used to living conjugally, which was together in one area, And I loved, Tommy Haley had said once, we don't want people traipsing around the gym because it's going to ruin the floors. And Jody said, what's worth more? The people we're serving or the floors of the gym. And I thought, that is the spirit. He helped everyone in some form or fashion, and he will be missed by our community. But I thank all of you, because all of you will be missed by our community if you, God forbid, anything should happen. So our prayers are with all of you, and my thanks to you for what you've done. You've been a leader for many years to help. What now, we have all these catchphrases now called trauma, adverse childhood experiences, equity, diversity, inclusion. And this is something that the Red Cross, I'm no longer with the Red Cross, I'm with the Family Connection. And when Zell Miller started this organization in 1990, which we thought was 1992, that is exactly what he said, that because the large social service organizations were so intent on fulfilling their own requirements that families and children were falling through the cracks. And every county in the state of Georgia received a $50,000 allocation to facilitate collaboration, which is something people couldn't even spell at that time. Now we're having trainings on it. And this is what we do, is that we work with people who are different to unite them around social issues to make change for the children in our community. And my passion is to help the children, because I do believe that they are the one voice, the one group that has no voice. And it is critical that we educate our children, we keep them safe, and we keep their families thriving. And that's our goal. And this is the picture of the Birth to Work pipeline, which is part of what we do, but I want everybody to see it.
Thank you. Thank you.
You can see in Newton County, we were a rural community that exploded in growth. So we never had the systems in place that were established to support children and families. Our WIC population grew 6 times its growth in 3 months in 1996. The county management had no way of catching up. And we did finally catch up, and then we had the recession. And after the recession, we were just coming back, and then we had the pandemic. But I believe that this kind of change, this kind of trauma, is what is just part of our daily life. And so what we have to do is build up our community's capacity to actually keep functioning, keep moving ahead while we have these kind of things that happen. And I think that's because we all work together. And the one thing that we do is we recruit volunteers. And if you ever hear someone say nobody volunteers anymore, you can bet there are people that do not volunteer. Because I'm telling you, and I'll tell you quite frankly, most of our volunteers who are active now are calling from the West Side, and they're coming from schools. And we work to establish systems change. Like, we know that the school has an unfortunate policy about vaping. And we also know that vaping is most attractive to what age population do you think? What age kids? What group? Elementary, middle, or high?
Middle.
You got it.
Yeah.
And the fact of the matter is that, like dandelions, they've popped up everywhere, and the school has a very punitive vaping policy, which was you vape once, you're in school suspension. You vape twice, you're out for 3 days. You vape 3 times, you're out for 5 days. 4 times, you're out for a week. What is a middle schooler's idea of heaven?
Being out.
Being home.
Yeah.
And also vaping, which is exceedingly addictive. It is nicotine. And so and this started because one of our youth action teams, participants who works at the high school level, his mom was a teacher in the middle school. And so she asked her son, what are you guys doing anything about vaping? And he said, actually, we do. We have an anti-tobacco initiative. And she said she invited Molly to come to her school, And they are now starting what's called a prevention initiative, which starts with the whole school population. Then it works with a selected group of kids who are at risk of vaping. And then they're working with children and their families whose kids are already addicted to vaping. Because the fact of the matter is the goal is to keep kids in school and off tobacco, anything that is addictive. And that's one of the system change things that we're working on with, and the school principal, when he heard about it because a kid told us, who told his mom, who told him. The principal would have never known that any kind of program was available. And so we're working with GNR Health to do that whole in-school vaping initiative. And Molly can't be here today because she and all of our volunteers are at the Career Academy hosting a Kick the Habit Day where kids design these activities. And this year it's a game show thing where you have to answer the right questions about substance abuse, or they have an HIV table, which is unheard of in our schools. They have all sorts of interesting things, and you're welcome to go over. We're going to be doing one at Indian Creek and one at Newton High as well. But that kind of system change and that kind of community awareness building is something that we're proud of and happy to be. And we are that little organization that kind of does something that no one else in the county does, and we're so grateful for your support. Does anyone have any questions about what our finances are or whatever?
Commissioner Henderson, and then Commissioner Mason.
Thank you, Mr. C. The question that I have is, I like several parents, we have children in school, my adopted daughter, and one of the things that she would come back and tell us that, well, we had a drug bust at school, and then she may come back another 2 weeks, oh, we had another drug bust at school, or we had the dogs over at the school. And so I guess I'm asking is, since there's no information as far as from the school system as far as what are the drugs that are being trying to be put into the school system, and what are we doing? I think this is something that cannot be silent. I think you have to kind of network with the parents and other folks to try to keep drugs out of our schools. And it's easy for somebody to write it on a piece of paper, post it on the wall, or put it on a sign or something, but it's about actually doing something. You can't keep stuff like that, I think, silent. You got to ask for the help of the parents and all of them. And the same as vaping. You're right, kids, you can walk down the streets, at least where I live at, and if you're in town, and you see them vaping. Now, we knew a long time ago from our age that smoking nicotine was very addictive, and it did cause cancer. And yet, they let these big companies come in and bring all this stuff into our communities, and then they're doing the same thing that tobacco did because it's got nicotine. And so I think we just need to governmentally look at ourselves and see what we can do.
You're absolutely right, and one of the things that is finally the CDC has accepted, and the feds, is that there's going to be a drug du jour every day. Something new comes out. You can't keep, it's like whack-a-mole. Knock that out, knock that out, knock that out. The fact of the matter is what you have to do is build up the community supports so kids and families, adults, feel that they're worthy, they are valued, and they have a say in what decisions are made. And if you do anything without going to your community, and that is what our strength is that we activate all the time the community voice. But there's something called protective factors, and finally the Drug Free Coalition is allowing people to address building protective factors, which is putting in policies at school that help kids overcome these habits or help kids make better choices. And the mental health supports that are coming out that the funding is finally available for are critical pieces, because what they have learned is that children, particularly in low-income schools, all kids, let me tell you, some of the worst offenders are the kids of the, most wealthy parents. However, they know where to get the resources to get the help. It is children who live in communities that are isolated that don't know that have that access. And that's why we have to put our communities together and have communication across social, economic, color lines to build that web of protection. And that's called wraparound care. And that's one of the things I'm so excited about working with juvenile court. They are rebuilding their wraparound care program. We were integral to that in 2006. We were the conveners of it in 2006. And those are the kind of things that we want to do, is help those kids feel like they have a hope outside of court. Like, okay, I'm going to make a lot of money selling drugs, but if I get caught, I would rather be doing something different. I'll make less money elsewhere, but give me a purpose.
I just have a follow-up, and I'll be through, Ms.
It takes us all.
Yeah. You know, never in my life, all the years I've been on this earth, in this community, would I ever know that we're trying to distribute Narcan to different places in our
Is that the
community.
Narcan kit?
No,
Yeah.
for people who overdose.
Yeah.
And I've seen people who, the ambulance, maybe not too far, and I know a few people know who I'm talking about, people just laying out, and you want to help, and the only thing you can do is call the ambulance.
Right.
And we got an epidemic. They're filling all stuff, and what they're smoking and what they're doing is really bad for our community.
Well, we started that partnership of the Narcan training.
Right.
And now it's going to be free, and we have a wonderful partner with GNR Health who is distributing Narcan kits.
Yes,
But
ma'am.
you know, our police are reporting up to 7 uses saving lives a month recently for Narcan.
Yeah.
With
And-
Narcan.
But I think, and I'm closing, the downside to it is I was listening to TV, and I kind of probably watch it too much, because there's more bad news and good news on the TV set, was they're going to start putting those in the stores, and you can buy them. So I don't know, we got a whole lot of
Well,
stuff we need to
these are
address.
kids who have lost hope.
Yes,
But I do think you have to look, and I think when you work in the field that we work in, it's amazing how many people are attracted to do something good. And I think the more that we offer them to do something good, the stronger our community will be. We don't have money for transportation now. We don't have money to do all the health equity we need to do. We don't have money for appropriate low-income housing, and we have a very high poverty rate. But we can work as a community to address and mitigate those factors, one person at a time.
Thank you so
Okay,
much.
this is, sorry.
Commissioner Mason.
Thank you, Mr. Chair. Always, thank you. I think Newton County Family Connection makes a major difference in our community. And so I personally appreciate the work that you do. Being a family man, I understand the importance of family. You know, having a wife, having 4 children, and, you know, living in the 21st century. Sometimes value on family isn't placed.
Right.
And so for you being in a position and being an organization where you can place or reestablish that value back into the family, I think is so important. And so I just want to say thank you. I did notice that you all were requesting $6,570 increase. Can you just kind of explain in detail what that $6,570 increase will cover?
Yes, we are rebuilding the literacy volunteerism because of the fact that most of our volunteers were retired teachers, and with the pandemic, everybody sheltered. So we are actually recruiting and investing in that program for 2-generation literacy to manage that program. And we do have 2 small grants, one from Dollar General, which we will have to sit out this year, of $10,000, and we have $5,000 from General Mills to help facilitate that. But we would like to pay a part-time person roughly $17 an hour for, I think it's 20 hours a week, to actually be the point person for that. And we really hope to grow that as we go into a person who is a point person for volunteer, the poverty initiative that Ms. Fury started. We believe that that is placing someone who's of middle class with someone who is of poverty to help them navigate the barriers that they have to overcome poverty. It's going to grow into that initiative where, and someone has to stand in the gap to be the point person if there are problems. For example, people in poverty learn to ask for groceries, gas, everything all the time. If you're a navigator and you hear that all the time in middle class, you're like, I'm done, I'm tired. So we set the rules and the standard, and the priest or pastor who actually manages some church volunteers doesn't have to say, I'm sorry, you're inappropriate for this situation. The Family Connection would stand there and say, we stand in that gap, that we will say that we have certain rules and regulations, and that's the model that we have used forever.
Excellent, thank you. That was my only question.
All right, listen, thank you so much. We greatly appreciate all that you do again for this community. Thank you.
I just have to tell you, you guys have a yeoman job, and I thank all of you as well. Thank you.
Thank you as well.
Up next, we're going to bring up our clerk of courts, Miss Linda Hayes, and she's going to be back in your department books, and she can be found on page 108 of the department book.
Good morning.
Good morning.
Well, no, no, you didn't. We'll talk about that later. Oh. Before I start, does anyone have any questions that they want me to answer before I tell you? We really haven't added anything new. We've had to increase.
If you want to just give us a very high view of some of the increases you had, and that'll be fine.
Okay. I think we've just had to add a little bit because our vendors have gone up.
Mm-hmm.
And of course, with as much court as we're having now, there's no way to tell when the judges are going to call special terms. We've already had, we've had at least 2 weeks of court, just about, I think, January, February. We've had 2 weeks in March. We're going to have 2 weeks in April.
Yeah.
And we usually have 2 judges at the time, plus the other 2 judges usually are having hearings. So our line item has gone up there because we have to pay our jurors. We are using jury cards, like a little credit card. And I think y'all have seen those before, so that saves on the computer checks and postage, things like that. So that seems to work well. We do have a couple of new things that I wanted to tell you about that are going to be great for the public. There's always so many scams that go around, and I try to get the notices out about that. Every time we have court, somebody starts calling and wants people to pay money because they haven't shown up for jury duty. And we try to keep the notice out there. You know, we never call and ask for money if you don't show up for jury duty. But some people have actually put money on these green cards and have told them to bring them to my office.
Wow.
And some people have lost money. But I believe Brian has put that on the website for us.
Mm-hmm.
We put it in the newspaper, and this is something else that is a free service to the citizens. It's called Filing Activity Notification System, FANS. You can go on the this website, put your name in, and if a deed is filed anywhere in the state of Georgia, this will notify you of that. because some scams have been going on with people trying to sell other people's property. And when someone brings something into the office to be filed, you know, if it's in proper filing order, then that's all that is required of us, is just to make sure that it's witnessed, notarized, and in the proper form to be filed. So I wanted to give y'all this. And maybe you could pass it along if you have a town hall meeting or website, something like that, because it really is a good service for our citizens.
Thank you. Doing good. So I'm just gonna, I'm gonna open it up for questions, see if they got any questions. I'm just gonna open it up for questions, see if they got any questions. Bless you. Commissioners, do y'all have any questions for Ms. Linda?
There's one more thing. We're still continuing to work on our project to get as many records online as we can. So that's kind of expensive, but the clerk's authority is helping us, plus what the county gives us. They are also providing small printers, computers, shelving, things like that for us. So that saves the county a lot of money. And we do have a e-certification program. So now a citizen can go online if they want a copy of something. And I believe, Brian, maybe you put this on the website too? This is a great service because they can get as many copies as they want.
Okay.
But this tells you exactly how to do it, and then you don't have to come into the office to get a copy of a document that you're looking for.
Y'all do. Oh, me.
We really appreciate everybody's help. Everybody's so supportive and helpful to us, and we really appreciate that. Appreciate the jobs you do. I know they're not very hard, but we do appreciate what you do. No, hard wouldn't be the word, would it? No, I appreciate your leadership. We do, and I appreciate Brittany and her staff. They really worked hard.
Yes, ma'am. I have a quick question. I noticed that it seemed like you've been struggling the past 2 or 3 years in storage. Oh, where are we at with that, Rick? Storage, for his documents over at your office. Storage.
Mr. Storage, yes, I
ma'am.
wrote that down. We do need storage, and I think that's probably a need that everybody has. And I know that I had talked with Jason about that, and he might have mentioned that to y'all, maybe trying to look for a place that we all would have some storage.
I think they're gonna be able to take care of that with SPLOST.
Oh, great,
Yeah.
great.
I think that's one of the SPLOST problems.
Yes, and so what I was hoping, let me get a little closer. What I was hoping that since we had the officer sheriff in his building over there, it really leaks, and he had kind of explained this to us, if we could renovate that particular building and use the bottom level for more storage, that might help you for a while, and that's something that he had mentioned to us, and something that I would like to see us do. And so, I guess since you had mentioned that, Mr. Chairman, would that, is money splashed to do
I
some?
think it's to build a building for storage. So I think it'll be storage for the sheriff, the ad man, and the clerk, I mean, not just the courts system itself.
Okay.
So I think it'll be a building for storage for all the operations of the county.
Okay. So I guess what I'm saying is, so the old jail, the one that the sheriff have officers in, that he explained to us the other day about the mold in it.
yeah.
So hopefully we can fix that up and still maybe, I guess, from capital improvements. And so is that something that we could address during, I guess, the budget? And I guess I'm relaying that to Ms. Brittany. Could we address that during the budget about maybe using some capital improvement funds for restoring that building for the officer sheriff, and then hopefully we restore it, then that could be additional storage. Because you want to be secure. You
Oh,
want to
yeah.
be, and I don't think nobody would want to come in and possibly destroy any records, but when you got a sheriff department over there at the top.
Thank you. That would be a big help to everybody. We had a notary class back before COVID. I had 300 people to attend. And that's something we want to do again because so many people get commissioned and then they really don't understand their duties as a notary. So we're planning to have another one of those. Let's see. We still have our special courts going, and I think those are growing. Another thing, and maybe I could get Brian to put this on our website. If people would bring in their military discharges, we record those at no charge. And so many people think that the VA just sends those to our office, and maybe they used to do that, but they don't anymore. I wish they would. I wish we knew how to get that done, because a lot of people don't have that when they need it, but we record those free of charge. And that really helps a family, you know, if a military person passes away. Because there's a lot to do,
Yeah.
you know, if you've been in the military. So if we could get that out there too, I'll get with you about that.
I think Commissioner Mason had a question.
Oh, okay.
Thank you, Mr. Chair. Thank you, Ms. Hayes, for this presentation, as usual. I was noticing here on the education and training, it still remained the same, 2,400, but then I saw a difference in the travel, meals, and hotel. So is the travel, meals, and hotel just for the education and training, like when you go to travel somewhere? So if that is the case, I'm trying to figure out where the $2,200 increase will come in if the education and training is still the same.
It depends on where our board decides to go. And we have to pay for registration.
Right.
And that all depends, you know, we never know how much that's
Right.
gonna be.
Right.
So we were trying to cover that plus the other. And we have mandatory training, and
Right.
I'm on three different boards actually, the council, the association, and the Constitutional Officers Board of the state of Georgia. So.
You sound like me. I'm on two different. Okay. Okay, I was just trying to clarify that, because I was
I
thinking.
think we just broke it out, I guess.
Okay, yeah, I guess I was thinking if the education and training would still be the same, that the travel, meals, and hotel would still be the same. But there would, if education and training was increasing, then your travel would increase. So I guess I was just trying to figure out where that.
It could be, but I'm trying to keep it down.
Yeah.
You know, I don't have any control over that.
Right.
Just like y'all, you know, you
Right.
never know what it's gonna cost.
That's
so.
right, absolutely.
And everything's gone up.
It has. Okay, thank you for that explanation.
Thank
Thank you,
you.
Mr. Chair.
Yeah. Any more questions? Thank you so much for all that you do. We greatly appreciate you.
Oh, well, thank you. I appreciate y'all, and thank you for giving me the time this morning.
Yes,
I'm
ma'am.
gonna leave these maybe over with Brian,
Okay.
and maybe some of the other commissioners might want those.
Okay. Thank you.
Thank you. Appreciate y'all.
Up next, we have Washington Street Community Center. This will be back in your appropriation book, and this is the last time we're going to switch books today. They can be found on page 156 of your book, and they are requesting,
Good morning.
Good morning.
$46,750.
There you go.
Good morning.
Yeah.
No, he's just attorney. No, he's good. It's Patrick. No, he don't need it.
Okay.
You get one? You got one?
Come on, Miss Carol. Did Michael stand with me?
Oh,
Come
okay.
stand.
Good afternoon,
Good afternoon.
Mr. Chairman
Good
and our
afternoon.
commissioners. It's that time of year, I suppose. And of course, we're always excited to come before you and to share with you our good news. I must say, though, I'm gonna make my presentation kind of short and sweet, because I have a few comments that I'd like to wrap up with, if you may. Indulge me a little bit.
Okay.
Overall, the state of the center is solid. We are excited and over the moon with the facility renovation that was awarded to us by you and the citizens of Newton County. We feel forever grateful. And we spend each and every day making sure that the funds that have been allocated to us to get the job done happens each and every day. Our center, we continue to thrive. What can I say? And we continue to open up new doors of opportunities for our students as well as our staff and for the families of the children that we serve. What we do know is that we are making the impact that we set out to make, and some of the information that I've shared with you today further exemplify that for us, to let you know that we are on par and we are on board with the Washington Street Community Center. We continue to be that entity that you can most definitely be proud of. And I think we all share in some of that accolades and the rewards and all of those wonderful things that have happened because of Washington Street, but we couldn't have done it without you guys. And we couldn't have done it without the entire community having the wind at our back. It was also done with a very strong board of directors who believe enough in Washington Street that they've gone out and helped us to supplement a budget that has increased over the last 20 years to satisfy and helpfully, sufficiently help us to continue to do the good work that we've begun. Our plan is to continue to do that. So again, this year, for the 4th year in a row, we're asking for you to consider giving to us the appropriation for which we've requested in our application this year. However, I'm beginning to hear sounds and buzzes and noises about how you guys are going to take a look at Washington Street moving forward. I don't necessarily think it's been a fair process. As a matter of fact, we waited for over 2 years to receive some funding that we thought we were going to get, and the rules changed. The rules have changed about 3 times now. Carolyn and myself, who makes up the critical staff of Washington Street Community Center, spend hours preparing these documents and making sure that financially the center is sound, and we open our books to anybody who would like to have a review. And for those of you as the board here, we've also complied with every request that has been requested from us for the county. Now, mind you, that the amount of funds that we request from the county really represent about 14% of our overall operating budget. The rest of it, we go out and we earn it, and we've earned it by our reputation. We deliver on what it is that we say we're going to deliver on, and we've been nothing but absolute great stewards to those funds that have been entrusted to us. Over 20 years, I have dedicated myself to making sure that Washington Street receives and is done no less than what has been expected of us. I don't think that it's quite fair at this stage of the game, 20 years later, to reverse your support of us. It's important that we receive your support because we use that too to help us to generate those funds that we get. Our communities, our funding communities, want to see that our county government support us. It helps us to move to the next level. We have spent the last 2 years since the pandemic and the recession building a solid relationship with our state. Yet I hear that there are state nonprofit organizations that exist within our county, but that we're not seen at the same level. I somehow don't know how that's fair. And how I look at the Newton County Partnership, I was here when it formed. They were like me. So it was clean and beautiful. I'm now told that there are state-supported agencies within our county, and they receive full allowances by all of you. I feel personally, and I think that my board also agrees with me, that somehow we should have been given some of those types of considerations. At least we should have been grandfathered under some clause. Now, we've paid money for a county attorney and for a consultant when you already had the perfect example before you of what a nonprofit organization that this county should have used as an example, not punish us, so that we are also considered and put in the same bag of tricks with everybody else. That's not fair. So I'm appealing to you today to say that we think and feel very strongly that we still need and want the support of our county in the manner in which it is, and that you guys should consider grandfathering Washington Street. We're not the same, and we can't continue to be compared with other organizations because we've done the work. We've put in the time, and we have done the work, and we get the results, and they're proven results, whether it's through our financial reviews or whether it's through our programs and other things that we manage through Washington Street that receive the accolades and acclaims that it does. So I'm just asking you to be mindful of that and to consider our requests, and that we should be looked at a from different priorities as well as different qualifications that make us a viable organization. I have not given my life and time to 20 years in this county to see us roll back now. Thank you for your patience.
Thank you.
Anything you want to add? They're done. Any questions of you?
I do.
Mm-hmm.
He beat you first. Commissioner, no, you was first. Go ahead.
Well, first of all, thank you, Ms. Jackson, and the Washington Street Board for what y'all done in the community. And I don't think that there's a commissioner on this board who have supported Washington Street more than myself. And I have first question I'm gonna ask you is, you said that you seemed as if you had been mistreated, and I'm just kind of.
Only in terms of what we hear is forthcoming, in terms of how the county is looking at partnering or providing appropriations to nonprofits. That's what I'm referring to.
Okay.
And in that instance, no, I don't think it's fair.
Yes, ma'am. And I just want to be sure that what I was hearing, and you're 100% right, is not fair. And it's something that most people who know me, I've said that when we was talking, we got the wrong attorney, Patrick, and I said this up here before everybody, and I said it again, who is kind of moving us in the direction, but he's leaving some out. We've got, even in District 4, and you're in District 4, we have nonprofits that don't even have to come to this board. Nonprofits that we pay the utility bills, we pay everything for them, and it's okay. Except for two, maybe they thought it was 3 black organizations, McIntosh, and found it was through the state, White Streak and Nelson Heights. And there's a difference. The difference is that I apologize because in order to make one organization look bad, they had to pick up more than just one. And they're picking on, it's really Nelson Heights.
It's Washington
They're
Street
picking on
Community Center as well.
They're just throwing you into the bucket with us, and it's double standards. You can't say you can give 3-year review to one nonprofit, and you say an audit, and then when you do your review, and it's okay, and they stamped it, because I got the paperwork. They stamped it and said it was okay, and then come back and say, no, you got to have a review. And they said, I said, well, why do you give them a 3-year review and you got an audit? They said, well, we're going to go back and tell them they're going to have to do it too. That's not right.
No,
I
it's
told
not.
them that.
And we don't have the funds to pay for an audit. I mean, it's not worth it to us almost. If we're talking about the limitations of how much each nonprofit, and we're compared in that same bucket, it's not worth it to us.
Including, I'm going to say this. It's time for these people to stop playing politics.
I stay out of the politics. So I stay over there on the hill. I know, I got you, but I'm just I want to make sure everybody understands that. We stay up there on that hill, and we do our job, and we bring it. That's what I know. I let you guys do the politics. We are not trying to make enemies. We need as many friends as we can get, and we want to make sure that everybody in Newton County knows our story, and anybody in any family that needs the help that we're able to give them, that they can come our way. You know, we now decided to move on from just having our focus on children, but looking at our community at large and what's the need there. Newton County, we got a lot of need out there that's not being met. You know, we recently held a job fair that attracted more than 100 of our residents. That was 2 weeks ago. And last Thursday, we held a town hall meeting that was filled to capacity. So we're out here trying to do our part. We just want you guys to do what's fair. Thank you.
Thank you. Commissioner Mason.
Thank you, Mr. Chair. Thank you all. Thank you, board. We appreciate the work that you do for our community. And I just want to say, you do have friends on this board.
Thank you.
Of course, I can't speak for everyone
I know that.
on this board.
I have friends. All
That's
of you
right.
are my friends on this
But
board.
you do have friends
Yes, thank
on
you.
this board.
Thank you.
And so, as a matter of fact, I believe I was the only one
You were.
on this board that recommended
You were.
that you actually get ARPA funding.
Exactly.
help
However,
support
that
it.
we never received, by
We-
the
we-
way.
we gonna work
that
on
we've
that.
applied for it 3 times.
We gonna work on that
We've
too.
jumped through the hoops.
Yeah.
We've done what was been asked of us. I think that it's only fair that we were treated with the same type of respect.
Absolutely. And so we definitely want to make sure that we address any concerns centered around that particular area. And so we want to make sure that Washington Street continues. The new renovation of the facility is amazing.
It's
It is
amazing.
awesome. It's beautiful. When I walk through those halls and through those rooms, it's astonishing. And then just to be there and hear some of the music the children play and, you know, sing and do those things, it shows what you're doing within the community. And so I just wanted to reiterate to you and to the board
Thank you.
that you do have friends on this board. In spite of what some may say or what some may not say, you do have friends on this board, and we want to support Washington Street Community Center. You know, the 20 years that you've put in, we want to make sure that it's not in vain.
Thank you.
And that you continue that work and that we can continue to support you and do what is needed to help our children in our community. So I just wanted to say thank you.
And enough said.
I got Commissioner Henderson, then I got Commissioner.
I'm just gonna kind of close this statement. I went to the school when it was first up there.
know.
I ran up the hill, and sometimes with holes in the bottom of my shoes trying to get an education. And I got a pretty good education. I was there when they changed the school and they pushed it down and took the little memorabilia with them, or whatever they put in the trash can or whatever. I was there. I was a part of that. I was there when I went over to Washington Street Community Center with Forrest Sawyer Sr., and it wasn't nothing but a shell of a building. I was there. I talked the board, not this board, but I talked the board into giving SPOS funding to renovate it so that it could be used. So I was there. So there's nobody on this board, I think, who loves Washington Street more than J.C. Henderson.
And we
that
thank
did
you,
more
Commissioner,
than J.C.
for the
Henderson.
love. We
Only
do.
thing that I'm saying, and I'm closing.
Okay.
Only thing I'm saying is that let's stop treating Nelson Heights, and they don't got really two community centers, I think, that are color or minority or whatever you want to say. Just start, instead of trying to figure out a way to make them, give them headache or excess stomach acid, figure out a way to help them. Because our children need help, not only on Washington Street, they need help all over the county. Because our children, even in District 3, they need help.
Everywhere.
And so let us stop and work together.
Well, thank
I'm
you.
through.
Commissioner Edwards.
Thank you, Mr.
Commissioner?
Chairman, and
Hi.
thank you for coming here today. Thank the board too. You know, the last 3 or 4 years, I don't think you can dispute the fact that nothing but praises have come from this seat
Yes,
here.
it has.
I believe you are the standard.
Thank you.
I've said that more than once. I believe you are the standard. I try to understand the impact you have in the community. I live way on that side of the county, so it's not always easy. But I have been there. So I just want you to know that I believe this board holds you way up here as the example, and we will work to get to where we have to get to provide this money for you without a hitch.
Thank you.
So
That's all
just
we
know
ask.
that.
I
I
do.
appreciate you bringing the concerns, but just know that this board is friendly to what you are doing and understand the impact that you have on our community. Just know that. May take a little patience, but just know that.
Okay.
All right.
Thank
Thanks
you.
so much. Thank you, Mr. Chairman.
And I appreciate that.
So
We do.
and we gonna close out.
It's
this,
okay.
But Ms. B has so eloquently outlined how and what Washington Street does in this community, and how they welcome anybody to look at their books. They get, I think y'all get a state grant.
We
It's not-
get state funds, and
Yeah, they
we've
get
been
state funds as
certified by
well.
the state. We've
Yeah.
got SAMS, we've got E-Verify. We've got what it takes that you're asking for.
Yeah.
We've done the work.
Yeah, so, everything that we're asking, they have. So, you know, I don't see what the issue is.
Okay.
And
Yes, ma'am.
when you come to the office, my name is Carolyn Hightower, and I'm
Yes,
the
ma'am.
finance and special projects person. You come to my office, the records are there. Most of them are computerized, but I do still have files. Because I have all the records from the beginning of Washington Street, the financial records, they're in the computer.
Yes, ma'am.
Saved on a hard drive, you can take away. But you can come and ask me any questions about the money the county or anybody else has given. And I can show you the documentation and where it went, how it was spent, who gave it to us, when, even contributions for people in the public. All right? So just feel free, come, ask to come. If I'm there, you're welcome.
Well, we
Okay.
greatly appreciate, I think Brittany you had something? You don't have anything? Okay.
Okay.
Well, we greatly appreciate you guys and everything that you do.
We do.
And the service that you provide in this community.
And we thank Brittany for all her help.
I have one last.
Go ahead,
one
Ms.
last,
Henderson.
Ms. Brittany, is that you were told, and correct me, mic to my mouth. You were told that the 3-year, what do we call it, 3-year, what they did a 3-year, refresh my,
Financial review.
financial review was sufficient. She was told that. So when the question was asked, how can you give one nonprofit a 3-year review, and the other one you want an audit from, when you ask that the audit be did by the review be did by the other one? So how can you give one a 3-year review? And they told, they did it. I seen the paperwork. And the other one, you said, well, you talking about 2 nonprofits. And when this board, y'all said, or we said, that it was supposed to be an audit. And that, so how can you treat one different from the other? It should have been a 3-year review of all of them. And that's what Fleming and I said. They said, well, why are we doing something different? And then they come back and say, well, oh no, they got to do an audit now. So you tell me, what did Patrick say?
Patrick said what's in the resolution that what the board passed.
Patrick said a audit. He went back and changed on y'all and said audit.
That's what the board voted on, an audit. But no, the board voted on an audit. Washington Street welcomes the audit. They done did plenty of audits before. The director just stood up here in front of us and said they welcome a audit. The finance director just stood up here and said, you can come and look at their books anytime you get ready. All you got, no, I'm addressing them. About you talking, you said about the, yeah, you said about the audit. So if I'm saying anything wrong, you correct me. So are y'all saying y'all welcome an audit?
Absolutely.
Any day, anytime?
If that's what, yep.
I think the county paid for Nelson Heights audit. I think they.
No, the county paid for an audit that was did by the county.
The county hadn't did no audit on Nelson Heights. No. The county.
Can we be dismissed?
Yes,
Okay,
y'all can. Thank y'all. Thank y'all.
We appreciate you.
Thank y'all.
Thank you.
Thank you. Commissioner Henderson, the county has not.
I want some money.
The county has not. The county didn't. You. Who hired the guy? I will. Let's do it. You cut my mic off. Let's do it next week. That's cool. All right. We done with we got the library right here. Yeah. We got a couple more to do. We get a wine shirt. We gotta get one. Yeah. No, I'm gonna meet with you. Yeah, I'm gonna meet with you. No, I'm serious. Okay. Yeah. The library.
Up next, we have the Newton County Library. They are requesting $926,452, and they can be found on page 176 of your book.
Hey, Mandy. How you doing? I'm well. You doing okay? Good. Miss Keaton, how you doing?
I'm good. How you doing?
Doing well. You doing okay?
Good. Do you know how to do it?
Thank y'all for being here today.
Thank you.
Thank you.
Thank you for having us. We sent you all our basic appropriation request back in February, and I think Mandy just handed you some packets with a little bit more information. So we wanted to tell you that it's been a while. We've never actually done a PowerPoint presentation for you all. I think we just got up and talked about it. And we wanted to tell you a little bit more about the library instead of what you actually have been hearing from us all these years, because things have changed a little bit. So we wanted to tell you, as Perfect Library, a little bit more about the story, what's behind the story, and because nobody really knows what public libraries do. I think everybody assumes they know what libraries do, but not necessarily. Okay, so we'll give you the real story. Okay, so basically, society thinks all we do is sit around and read books all day. That's what they think we do. Our parents think we dress up and we do story time all day long. next one. Our friends think all we do is file cards and cards catalogs all day long with new books. Hollywood thinks we're a bunch of little old lady librarians. This is what we think we are. We think we're great. We think we're library ninjas, and we save the world by helping people find information that they need. But how does it really work? So there are actually four different kinds of libraries in the world. There are academic libraries, which are college libraries. There's school libraries, which is K through 12. There's special libraries, which are law libraries, and like Coca-Cola even has a library. And then there are public libraries, which is what Newton County is. And in the state of Georgia, who's in charge of public libraries? We fall under the university system of the Board of Regents, is who we fall under. And then we are under Georgia Public Library Service, which is basically the state library, but we call it GPLS. So you have some flyers in your handout that talks about what they do. There are actually 60 public library systems in the state of Georgia, and each one of those 60 library systems has a board of trustees and a library director. So within Georgia, there are also different kinds of public libraries. There's rural single counties, rural multi-counties, urban rural multi-counties, and then single urban counties, which is what Newton County is. They all are considered nonprofits, which means that we can accept grant money, and we do not need a 501(c) to accept a grant. So we are still a tax-exempt institution. So what does all this have to do with NCLS budgets? I'm sure that's what you're asking yourself. Everything. Because we receive our money in this way. We get state money and local appropriations. The state gives us something called state grants. And there are salary grants, materials grants, and system services grants. And then, of course, we get our local appropriation from the county, the city, and the school system. The first one that they give us is a salary grant. And these grants are based on population, population, population. Back in 2013, the Office of Planning and Budget said, you all need to find a way to equalize how you give money to public libraries in Georgia. So they came up with, they threw everything out, started over, did zero-based budget, and said, we're gonna give public libraries in Georgia money according to a funding formula. So that's how they figure out the grants. To do the salary grant, to accept the salary grant, and there's no exceptions on these, you have to have a Master's of Library Science to be paid with state funds. You have to have a state certification, which we are actually have licenses to be librarians in the state of Georgia. We're on the Secretary of State. There's no exception on that. If you don't have the master's degree in library science from an accredited university and the state certification, you cannot be paid with this state money. Every library system gets one position per county and one position per 75,000 people. So Newton County gets two state paid positions. One has to be the library director. You have to have a Master's of Library Science and a state certification to be a library director of public libraries in Georgia. It can only be used for professional positions. We cannot use that money for anything else. But NCLS actually has 5 librarians, but we only get state money for 2. The materials grant is the next one, which is per capita right now, is 60 cents per capita. It can only be used for materials, again, based on population. The third one is kind of tricky. It's called the System Services Grant. It can be used for operations, but they figure it out by the difference between what they say the population is minus 75,000, and what's left between those two numbers is what the System Services Grant is. Okay. All right, so with our revenues, as you can see, that the majority of our revenue comes from local appropriations, then state, and then of course other revenue. This is for FY23. Other revenue, which is, our fines and fees and things like that, are a little bit less because of COVID, because we weren't open the same amount of time that we were before, but the more we increase the hours, the more that tends to increase. Okay? Our expenditures for FY23, as you can see, the majority of our money goes to salaries and wages and benefits for our staff. So, what do we do with the money? Of course, we have library cards to use library services. Over 4 million people in Georgia have Pines library cards, and Newton County residents, over 40,000 people have cards in Newton County. We offer 40 different kinds of services for all ages. We have business, students, technology, meeting room spaces, genealogy, movies, things for seniors and adults, and of course, most of ours tends to be for children. So far this year, we have offered 75 different programs. We've had over 5,000 people come, and our door count right now is almost 37,000. It's going up all the time. And we have materials and how they circulate. We own over almost 104,000, and we circulated almost 107,000 for just this year. Our top things that we check out tends to always be the kids' stuff. The children, our children's materials circulate like crazy, and so do our DVDs. Let's see. And we also do a lot, what people don't know, we preserve a lot of Newton County history. We have been working with UGA on a digital newspaper project, and they just got finished digitizing a lot of the microfiche. So we have 7 different newspapers that range from 1835 to 1942. So you can go to our website and click on our website, and you can look at all the newspapers in digital form between those years. And there's 7 different newspapers. We didn't even know that. We thought it was the Covington News. And so we're still working with them. Of course, you need funding to do that, and so we keep working with them on how to get that. And we also have something called a Newton Film Collection, which we buy every DVD that we can get our hands on of anything that's filmed in Newton County. So we have like 60 different movies and TV shows. We have all the Vampire Diaries, all the In the Heat of the Night. So if you want to see some things filmed in Newton County, get a library card, come by and check them out. All right, so in February, we asked our patrons, what do you like about our library system? What are we doing? Does it matter? And how often do you use the library? 63% of them come at least once a week, which we were surprised that it was that many people. They come in there about once a week. 80% come to check out materials, and we asked them what was it they liked the most. They said the staff, and I promise you we did not tell the staff to fill out the survey to make that one of the #1 things. They like the children's programs and new books. That's all they ask us for is new books, new books, new books. We asked them, what would you like to see more of? They said new books. They want classes, like computer classes and, gardening classes, things like that. And they want more programs. We were surprised because we thought they were going to say other things like different technology and things like that, but they want classes on computers. So, we have to update our computers so we're able to teach them classes on computers. And we just wanted to tell you, we're not just asking it for ourselves. We're asking it for the people that use our library system so that we can keep giving them good services. So we share some pictures with you of some of those programs that we're having, and as you can tell, there are a lot of children, a lot of families that come out. And we just want to thank you for supporting us. We appreciate it, and I know our patrons appreciate it, and the more people that move to Newton County coming in all the time. So, thank you. If you have any
Well, thank you so much for presenting. Commissioners, you have any questions? Go ahead.
Thank you, Ms. Keating, for your presentation on today. I noticed that you were requesting, I believe it was a $10,000 increase in your budget. Do you mind explaining what that $10,000 would cover?
I think in the letter, what I said was inflation. Everything we have is going up. Even our health insurances, we found out, unfortunately, is going up again this year. I know we asked you last year for money for technology. We still need that technology.
Yeah.
So we have a myriad of things that we need to do. Both the operating expenses would be the main thing. Of course, people don't, we've had to increase salaries for people because, people don't want to work for $8.50 anymore.
Right.
So it would just help us out with operating expenses all the way around.
Great. And I was noticing too on our report, your funding source, do you know what percentage each one of these funding sources represent? Like what percentage the Board of Commissioners, what percentage the Georgia Public Library Service, Board of Regents, what percentage City of Covington, and what percentage of Newton County School System?
Okay, well what I can do is I can send that to you because I want to make sure I'm not just going to say, oh yeah, I think, go back and work it out, and I can email you the exact percentages on that.
They'll be excellent, because that kind of helps us to kind of see how your funding is compiled.
Okay. Other than that the pie chart that said 75% is local, you want to know within the local how many? Okay.
Yes, ma'am.
Sure, I can
Yes,
do
that would
that,
be
because
great.
it changed a little bit. It changes a little bit from year to year.
Yes.
So I will email that to you.
Excellent.
Get you the exact numbers.
And we appreciate Porter in District 2,
Okay.
next to Oak Hill Community. Our community love the library. It's beautiful, it's nice, and so thank you.
Thank you. We love it too.
Yeah. I actually have my best friend. He works in HVAC. Back in Oklahoma, but he does it for the library system. And so when he came a couple months ago, he wanted to tour our library and, of course, the main library in Fulton County.
Right.
And so when I took him to our library over off of Highway 212, he was just amazed at how beautiful it was, and the different rooms and the meeting rooms, and I mean, it was just great. So thank you for
Thank you.
keeping
nice
that
to hear.
facility. You're very welcome.
Yes.
Go ahead, Mr.
Thank you, Mr. Chairman. I just one little simple question. You were telling that you had to pay them more than $8.50 an hour. So what is what is the minimum wage that y'all are paying your employees?
I'm sorry.
You had said that people wouldn't work for $8.50 an hour.
Right.
So what is the minimum wage that you pay your employees now?
$15 an hour.
Okay. Thank you.
We couldn't get anybody to apply for anything less than $15 an hour.
I have a question. So, let's say over the last 12 months, have you seen the usage change of the library system in Newton County at all over the last 12 months? Increase, decrease, stay the same?
It is, it's based a lot on how many hours we're open, and we're still not quite back to how many hours we were open before the pandemic, because we're having a hard time finding qualified staff to work the jobs. You have to understand computers really well to work in a library now, because everything is automated. So that affects a lot of our numbers by just simply not being open, as many hours. But what I've noticed is people keep saying print's going away. Print's not going away. People are checking those books out as fast as we get them on the shelf. But we do see an increase in our ebooks and our e-audiobooks. It used to be that it was the physical audiobooks. Now I think the e-audiobooks actually are doing really well. So it's almost evening itself out, and people are doing it by what's most convenient for them. If they have time to come to the library, they get the print books. If they don't, they do it through our...
I didn't know. We've had over the last 12 months, we've had quite the build out in our internet infrastructure in the county. I mean, quite the build out. And I didn't know if that had in any way impacted your usage or not. I was just curious. That's the only reason I asked that question.
Okay.
All right. Thank you. Any other questions? Well, thank you all so much for being here. Thank you very much.
Thank you so much. Okay. Oh, I didn't get my bag.
FYI, the chairman had to get ready for an event later, so he asked me to just sit here for a minute. I think, I'm not sure why Ronnie isn't you want to sit here, Ronnie? Okay, who's Brittany?
We have one final presentation today, and this will be St. Paul Strategic Community Partnership. This is an organization that did apply for an appropriation when we had the appropriation applications up on the website, late January, early February timeframe. And then I just want to make note of one thing. The DFACS, the lady who is in charge of DFACS, she's out on FMLA right now, so she's not going to be able to present, but her information is in your book.
Thank you. Thank you.
If I may, I have a quick question to Brittany.
Yes, sir.
So since she's out on her family leave,
I'm sorry.
family, so will another appointment date be rescheduled to her?
She's out for, and I don't know how long she's going to be out. So I told her when she comes back to let me know, and we'll work on getting something scheduled for her. And then Commissioner Henderson has also asked that I mention that we are going to try to work in Nelson Heights too.
Please proceed. Thank you.
Thank you. The name is Robert Reed, and again, I'm from the St. Paul Strategic Community Partnership. First, I want to thank you guys for giving me the opportunity to come by and speak with you today. I gave out a handout, and first the handout just explains, give our mission statement, what we're trying to do, and basically what we were applying for is trying to get a grant to get our offices and stuff updated. You see, I gave you pictures of our offices and our food bank. A lot of the things that we've been doing by hand or my own personal computer. So we were trying to get funds to get a computer and 3 laptops. So when we open up our office, we will have everything centralized, all the data will be centralized, and we will be able to help our constituents in a better way. I've also given you on the back page where we've noticed that Dune County doubled its growth in the last 2 years. I don't know, I'm pretty sure you guys are aware of that. But you guys are also aware that we still have like 14% of our people below the poverty level. So that means we still need to try to make sure people don't go to bed hungry. So that's why we have the food bank. We want to make sure that people in our community have food. We also want to use the help with utilities, because we're in partnership to help with the elderly and those that need assistance with energy, rental assistance, or even mortgage assistance. And those laptops will be definitely useful for that, because when we're in there talking to them, we can show them exactly how to fill out the forms and what needs to be done on the forms. We also want to use that when we're using our partnership with the Department of Labor. You notice that we got a very high school graduate level in Newton County, but we're lagging in college level. The statewide, we're at 29%, statewide is like 39%. Being a graduate of Newton County High School years ago, I would definitely like to see that number goes up, because as we continue to double in size, we want to make sure that our youth have the tools and the equipment needed to get those higher paying jobs. That's another thing we want to do in the county. We want to make sure that everybody has that opportunity to be better. And if you notice, when everybody's doing better, crime goes down, the quality of life goes up, and everybody's happy. And that's what we want. So and we have our hours of operations down here as well. We do 10 to 12 Tuesdays and Thursdays. That's for the food bank as well as our office. And we have on Sundays, we have an hour after service for people if they need to get food from the food bank. We are definitely just getting started good, but we feel that there's a lot of work that needs to be done in our area, because on our side of town, the growth is just tremendous. And we want to continue to make sure that everybody has an opportunity to do well. This is just a startup, so we won't need anything more for as the computers and stuff are concerned. We will have the printers and everything else that we need, but we really want to get started this year on making sure that no one is left behind in the county.
Thank you. Any questions, commissioners? Commissioner Henderson?
Yes, sir.
Thank you. I guess it's just a one time, or just maybe you want us to look at it every year, same we do most of the nonprofits.
This is just a one-time thing here, Mr. Henderson, because this is just the upkeep of the computers and laptops is something we'll be able to do. That's not going to be an issue.
Right.
We have people that know how to utilize them and how to update those systems.
If I just could add,
However, we are asking that we continue. This is a beginning.
Well, absolutely.
We want to be a part of the countywide nonprofit organizations applications annually.
Yes, and I was just going to say that the program that St. Paul has is, and I'm pretty sure that Demond knows this too as well, because he probably be at church more than I do up there. That's a good program, and it's one that we should look at and really try to meet the need, because there's a lot of food insecurity even to this date. And there's no better way than to help somebody who needs help. And I think this is exactly what y'all doing. Thank you.
Go ahead. District 2.
Thank you, Commissioner. Thank you for this presentation, Mr. Reed. I appreciate it. St. Paul does amazing community work, and I'm just fortunate enough. I inherited St. Paul AME when I became a county commissioner back in 2019, and it has just been such an amazing partnership with the work that I do from here, sitting in this boardroom, and the community work that you all do, not only just in District 2, but you all are reaching anyone throughout the county. And so I just want to say thank you for that particular work. Now, I noticed that you all were only asking for 2,200, and that's just to get started. Now, we initially said one time, and then, of course, Ms. B said annually. So would this be 2,200 annually? Is that what we're requesting? Or do we know at this particular point?
I think it's unknown, but we're planning on asking for the maximum.
That's the Miss B I know. That's the Miss B I know.
Okay.
That's right. That's right. And the reason why I was asking, and I know I had a conversation with Dr. Logan, and of course Ms. Rita Reed, in regards to how we can begin to get some funding to get that food pantry started, and to even help the works that the church does. And now I don't know, have you all, because I know that you all are 501c3 now, have you all submitted for the current ARPA funding to kind of help?
No.
Yes.
It is in play, and we intend to have it submitted by the deadline.
Good, because, and the reason why I asked is because when I look at the amount that you're asking for and the potential amount that you can get through ARPA funding, like quadruples the amount that you can, get. You can get up to about 150,000 is what you can get, up to 150,000. If you qualify, there's 3 elements that you can qualify for. So you can qualify up to 150,000. So it would supersede the 2,200 that you're actually asking for, and will last you for quite some time if that 2,200 is something that you're needing on an annual basis, or even if you need to increase it a little bit, that $150,000 will kind of stretch a little bit further. And then, of course, I've also recommended for the food bank, we have another ministry in District 2, Faith of Jesus Ministries, who has an amazing food bank. And I think you all have begun to partner with them. And what my objective was to get them to kind of show you all what they're doing, how they're doing it, what resources they utilize, so that St. Paul can tap into those same resources. As a matter of fact, on April the 1st, they're doing a huge giveaway at Faith of Jesus. Normally, when they do a giveaway like that, they have well over 1,000 attendees that come to that giveaway. They have a lengthy line. I have photos of lengthy lines that they have. So they have well over 1,000 residents that come, and their food bank is just phenomenal. I haven't seen anyone like it before, ever. And they're constantly servicing the community. I've gone and visited their food pantry, their food bank, so many different times. I mean, they have from school supplies to clothes, adults, kids. They have toy rooms. They have barbecue grills. They have
everything.
They have everything.
Yeah,
they have microwaves.
It's
they
amazing.
have. It is basically a mini Walmart.
It is. And one of the things we were working with them, that's really how we help to supply our food pantry. So that relationship is, in fact, ongoing. Our need in our food pantry is mainly because is mainly to get the refrigeration that we need to be able to have perishable items.
yeah.
And so we need freezers.
Yeah.
But what we really need, and so we're asking for it in the other ARPA fund
Okay.
request,
Okay.
so that we can purchase a utility type building.
Okay.
You know, one of those
Yeah,
little
yeah.
put up there, where we
Yes.
can put a freezer and a
Ah.
refrigerator, because we
Okay.
don't necessarily think it's the best thing to keep it in the church.
Okay.
So that is really our goal, but we do also partner with the Atlanta Food Bank.
Yes.
And
that was
having
another
those
option.
freezers in the refrigeration is one of the requirements
Right.
that they have, that we have, so that's the only reason we haven't been able to further that relationship.
Okay. Well, I'll definitely want to keep my hand on the pulse to kind of help ensure that you all are meeting that ARPA deadline. You're getting that info, because I think that will be a great resource of funding to help you, because you can qualify up to $150,000.
We're on it.
All right. Well, I know you got Ms. B there. She's going to be on it. So I just wanted to put that out there and let you know that that is definitely another option for you as well.
Okay,
You're very welcome. Thank you.
Thank you. Thank you.
okay.
Thank you. Thank
Have
you.
a good rest of your day.
You too. Thank you.
too.
Guys, I think we're done.
We're not doing defects next.
DFACS, they gonna show,
Okay.
yeah. DFACS didn't show, right? DFACS didn't show up. They rescheduled.
She's on FMLA, so we're gonna, when she gets back off FMLA, I'm gonna get with her to try to schedule something.
And if I could also add, Ms. Brittany, I think we had said that you were gonna schedule a date because Anthony didn't get the email to you. Another date for Nelson Heights too as well. You wanna be, let everybody know, be clear.
Listen, thank all of y'all for being here today. I know most of us is going, I don't know who all going, but I know most of us is going to the funeral for Jody Nolan. So we're gonna go ahead and dismiss. Thank all of y'all.